Hi everyone, this is Learning English Pro and I'm Jer. You're very welcome to this Medical English Masterclass, a complete collection of my latest lessons all in one place. Whether you're a nurse, doctor, carer or medical student, this is designed to give you the real practical English you need at work and the confidence to use it as well. This video contains 11 full lessons and everything is timestamped below in the video description so you can jump to exactly what you need. Or let it play and immerse yourself in over 4 hours of high quality training. We begin with phrases for student nurses, followed by essential medical expressions that apply across hospitals, clinics, and care settings. You'll also learn the kind of sharp professional language that doctors need for consults, updates, and exams. And then move into 2 full listening challenge lessons designed to train your ear to understand fast, natural English in nurse-patient and doctor-nurse conversations. It's all here: injury terms, medication names, and even veterinary English. If you're preparing for the OET, there's a complete reading strategy guide and a full listening challenge to help you practice under realistic conditions. And finally, I've included a bonus lesson on childcare English packed with useful phrases for pediatrics, home care, or anyone working with young children in healthcare environments. If you're a student member, you can download all the PDF guides for this entire masterclass from the student directory, including over 70 other English guides, and student membership is $4.99 per month, and it includes all lesson PDFs, full PDF guide directory, early access to content, over 200 members-only English lessons, and priority requests. If you want a lesson, I'll make it for you. Everything here is designed to help you communicate clearly, kindly, and professionally in English, whether it's with patients, colleagues, or examiners. If you find this helpful, give it a like, subscribe, and let me know in the comments which lesson helped you the most. Let's get started. At the beginning of your shift, you'll be getting updates from colleagues, preparing to care for patients, and establishing yourself as part of the team. These next phrases will help you sound professional and confident as you get started. Let's check out our first phrase. I'm just starting my shift. This is a simple and clear phrase to let others know that you've arrived. It's especially useful when you enter a room or join a conversation and want to explain why you're asking questions or catching up. Our next phrase is, can I get a quick handover? This is a useful phrase when you're taking over from another nurse or student. Handover refers to the transfer of patient information between shifts. In American English, you might hear change of shift report instead. Has the patient had any changes overnight? This phrase helps you find out if anything important has happened during the night shift. You're asking about physical, emotional, or behavioral changes. What's the care plan for today? You can use this phrase to show that you're thinking ahead. It helps you understand the day's priorities for a patient. Care plan is a standard nursing term, and by asking this, you show your awareness of the bigger picture. I'll go check on my assigned patients. This phrase shows that you're organized and ready to take responsibility. The word assigned is important. It means these patients have been allocated to you, which is common language during clinical placements or shifts. I'm still a student, so I'll need supervision. This is a professional way to clarify your role and to remind others that you're not fully qualified yet. Saying still a student shows that you're progressing, and the phrase needs supervision sets clear expectations for patient safety. Can I shadow you for this procedure? This is a great phrase for learning on the job. When you say shadow, you're asking to quietly observe someone more experienced so you can learn while watching. It's polite and respectful and shows that you're eager to learn. Is there anything urgent I should know about? This is a smart question to ask during handover or at the start of your shift. It shows that you're focused on what matters most and that you want to prioritize patient safety. Let me know if I can assist with anything. This is a helpful and collaborative phrase. You should use it when you're talking to nurses, healthcare assistants, or other team members. It shows that you're ready to help and that you understand teamwork is a big part of nursing. I'll make sure to document everything. Use this phrase to show that you understand the importance of accurate documentation. Document is a formal word meaning to record information. Saying this out loud can help others trust that you're being thorough and careful. So that is our first batch of 10 phrases, all relating to starting your shift. Student members and those who have bought the PDF guide should turn to page 6 for the first exercise in the guide, which covers these 10 phrases. Next up, let's move on to our second section and our next batch of phrases. Section 2 is all about patient communication. Speaking with patients is one of the most important parts of nursing. These next phrases will help you sound more confident, caring, and clear, even when you're nervous or new to the role. Hi, my name is Jer and I'm a student nurse. This phrase is your go-to introduction. It builds trust with the patient by telling them who you are and what your role is. Keep it friendly and keep it professional. Saying you're a student helps set realistic expectations while you sound confident. How are you feeling today? This is a gentle, open-ended question that invites the patient to talk. It's a great way to check in and start a conversation. The word feeling lets them talk about pain, emotions, or general well-being without pressure. Let's move on to our next phrase. Let me explain what I'm going to do. This phrase is useful before starting any task or procedure. It helps the patient feel involved and respected. Let me explain is soft and clear, and it shows that you care about their comfort and their understanding. Is it okay if I check your blood pressure now? This is a polite way to get consent before a routine task. The phrase, is it okay if, shows that you respect the patient's autonomy. You might feel a little pinch. Use this phrase before giving an injection or doing anything that might be mildly painful. Saying a little pinch helps to prepare the patient while keeping it light and non-threatening. Tell me if anything feels uncomfortable. This phrase encourages patients to speak up. It shows that you're paying attention to their comfort and their needs. The word uncomfortable here is really useful as it's broader than pain, so it invites them to mention pressure, tightness, dizziness, or anything unusual. I'll be right here if you need anything. This phrase reassures the patient that they're not alone. It's great when you need to give someone space but still want to make them feel supported. It builds trust and emotional safety. We're going to help you sit up. This is a calm way to describe a movement or transfer. Using we creates a feeling of teamwork, especially if you're working with another nurse or HCA. I'll explain each step as we go. This phrase is very helpful when doing unfamiliar or slightly uncomfortable procedures. It lets the patient know that you'll keep them informed throughout, which can reduce their anxiety. Thank you for your patience. Our last phrase in this section is a professional and kind way to acknowledge that something has taken a while, whether that's waiting, discomfort, or delays. It shows respect and builds rapport. Well done, that is another 10 phrases under your belt. Which of these phrases are you most likely to use first? Let me know in the comments, I'd love to hear from you. For those with the PDF guide, turn to page 9 for a really great reading exercise that will test your understanding of these phrases. Okay, section 3, medical procedures and tasks, a really important section. As a student nurse, you'll take part in lots of hands-on tasks with patients. These phrases help you communicate clearly, prepare patients, and show professionalism during procedures, even when you're still learning. Our first phrase is, I'm going to check your vital signs now. This phrase is clear and reassuring. Vital signs refers to things like blood pressure, temperature, heart rate, and respiratory rate. Saying, "I'm just going to," gives the patients a heads up while keeping it friendly and structured. Would you like some privacy while I do this? This phrase shows that you respect patient dignity, especially during personal or sensitive tasks. "I'll just raise the bed slightly." This phrase is helpful when you need to adjust the patient's position. The word "just" makes the action sound small and non-threatening. "Can you roll onto your side for me?" This is a simple instruction often needed during bed care or wound checks. Adding "for me" keeps the tone gentle and polite. "Let me know if you feel dizzy at any point." This phrase encourages open communication during or after movement. Dizziness can be a sign of low blood pressure or other issues, so this helps keep things safe. "I'll clean the site before we begin." Use this phrase when preparing for injections, dressings, or IVs. The site is professional terminology for the specific area of the body that you're going to attend to. "I've washed my hands and put on gloves." This phrase is useful to say out loud, especially for infection control. It helps the patient understand what you're doing and builds trust. "Can you confirm your name and date of birth?" This is a critical safety phrase, especially before procedures or medication. It ensures you have the right patient, and using the word "confirm" makes it sound official but respectful. "I need a nurse to supervise me for this task." This is a clear and professional way to ask for support. It shows that you're aware of your scope as a student and committed to safe practice. "I'm not qualified to do that yet, but I can assist." This phrase sets a firm boundary while showing that you're engaged and willing to help. And that brings us to the end of this section. Altogether, that's now 30 phrases that you've learned. Well done. If you're enjoying this English lesson with Learning English Pro, make sure to subscribe to get regular updates on all my new medical English lessons. Our next section is all about medication and monitoring patients. Medication is, of course, one of the most important and sensitive areas of nursing. These phrases help you speak with confidence while staying within your student responsibilities and communicating clearly with patients. Have you taken your medication today? This is a useful and routine question to ask patients, especially during rounds. It uses the present perfect tense, "have you taken," because you're asking about something relevant to the current moment. This is to help with your pain. This phrase gives a quick explanation for a medication or treatment. "I'm just double checking the dose." This is a great phrase to use out loud. It shows that you're being careful. Double checking sounds positive and responsible. "Can I check your blood sugar level?" You'll use this often for diabetic patients. It's a polite and straightforward request. The phrase "blood sugar level" is understood by most patients. "Let me write this in the drug chart." This is a practical phrase that shows you're keeping up with documentation. Drug chart is the UK term. American nurses might say medication record. "I'm not allowed to administer medication on my own." This phrase is essential for maintaining safety. It's firm but respectful and reminds everyone that you're following your training requirements. "The nurse will be here shortly to give you that." Use this phrase when you can't administer something yourself. The word "shortly" is polite and non-specific. It keeps the patient informed without making promises about exact timing. This is a routine check for side effects. This phrase helps normalize a conversation about side effects. It's especially helpful when asking sensitive questions. Routine makes it sound expected and reduces anxiety for the patient. Have you noticed any changes since taking this? This is an open-ended way to monitor a patient's response to medication. The word changes is broad and allows the patient to share anything from physical symptoms to mood or sleep differences. Let's check out our 40th phrase. We'll keep monitoring this throughout the shift. This phrase is a great way to reassure patients that they're being looked after. That's already 40 phrases that you've learned. You're doing fantastically. If you've already downloaded the PDF guide, pause the video and have a go of the exercise for this phrase section on page 13. It's a fun exercise which focuses on grammar and professional tone. Bringing us up to the halfway mark is section 5, working with colleagues. Student nurses are part of a larger team. These phrases help you communicate clearly with staff, show initiative, and build professional relationships with other healthcare workers. Can I assist with anything? This is a friendly and proactive way to offer help. It shows that you're a team player and willing to support your colleagues. Would you mind showing me how to do this? This question is great when you're learning something new. Would you mind is a polite and respectful way to make a request without sounding demanding. I've done this before, but I'd like supervision. This phrase shows maturity and professionalism. You're letting people know that you've had experience with something, but you still value safety and feedback. Should I document that in the notes? This is a helpful phrase to ask when you're unsure about whether something needs to be recorded. What's the priority right now? Use this phrase when things are busy and you're not sure what to focus on. It shows that you're thinking critically and want to contribute in the most effective way. I can take the OBS in bed 4. This is a confident way to show initiative. OBS is short for observations, a common abbreviation in UK and Australian hospitals. I'm happy to help with the turns. Turning patients is essential for pressure care and often done in teams. This phrase shows that you're not afraid of physical tasks and that you value patient comfort and safety. And when you say you're happy to help, it also signals enthusiasm and team spirit. Can you check if I've done this correctly? This phrase is key to safe learning. It shows that you're open to feedback and want to get things right. Sorry to interrupt. Quick question. This is a useful one when you're in a busy environment. It acknowledges the other person's time while still making space for your learning. Thanks for explaining that. Really helpful. This phrase is always a good way to express appreciation when someone has taken the time to teach you something. Have you ever had a difficult moment with a colleague? Which one of these phrases would you use to soften a situation? Let me know in the comments. I love hearing from you. We are over the halfway mark of our 100 phrases. Now it's time to move into section 6, managing emotions and stress. And don't forget, on the PDF guide, all the content from today's lesson is included. If you want to follow along with this section, turn to page 22. Nursing can be emotionally intense, especially during your student placement. These next phrases help you talk about stress, ask for support, and process difficult moments with honesty and professionalism. Let's check them out. That was a bit overwhelming. This is a useful phrase to say after a difficult experience. It's honest, but not dramatic. A bit softens the emotion while still acknowledging that you're affected. Can I take a moment? This phrase is simple but powerful. It gives you space to breathe, especially after something emotional, like a patient passing away or a challenging interaction. I found that situation quite upsetting. Use this when debriefing with a mentor or nurse after a tough moment. Quite upsetting is a controlled way of expressing emotion. It's professional, but still human. Do you have any advice on handling that better next time? This is a reflective and mature phrase. It shows that you're thinking about your own performance and you want to improve, especially after a mistake or a stressful situation. I'm not sure how to respond in these situations. Use this phrase when something catches you off guard. It's better to admit it than pretend to know what to do. It opens the door for learning and shows that you want to do things right. Could we debrief about what happened? This is a professional way to request a follow-up conversation after something challenging or intense. Debrief is common terminology in healthcare, and it shows you're processing things in a thoughtful, clinical way. That was a really emotional moment. This phrase helps you connect with your experience honestly. It works well in both formal debriefs and informal chats with colleagues. It allows others to validate your feelings and support you. I'd appreciate a bit of guidance on this. This is a respectful way to ask for emotional or practical support without sounding unsure of yourself. A bit of guidance keeps the tone soft and open rather than sounding like a formal request. I just need a minute to gather myself. This phrase is helpful when you're feeling flustered, upset, or even overstimulated. It helps set a gentle boundary while showing your own self-awareness. Our 60th phrase is, I'm still learning how to cope with these situations. This phrase is useful when reflecting on your growth. It shows that you're developing resilience and that you know emotional regulation is part of the job, not something you'd expect to master overnight. Over the years of teaching medical English, I've found this type of language which deals with emotional stress really important for healthcare professionals. Repetition is key, so make sure to come back and practice these phrases. Each section is time-stamped in the video description for easy navigation, so you can jump to the section that matters most to you. Staying on the subject of mental health and emotions, our 7th section deals with difficult conversations with patients. Sometimes you'll need to handle conversations that are awkward, emotional, or even distressing for patients. These phrases help you remain calm, compassionate, and professional, even when the topic is sensitive. I'm really sorry you're feeling this way. This phrase has a lot of compassion when a patient expresses distress, pain, or sadness. Really sorry shows genuine empathy without taking personal responsibility. I understand this must be difficult for you. This phrase helps you connect with the patient's emotions. You're not claiming to know exactly how they feel, but showing that you can imagine their struggle. It builds rapport without making the situation about you. I'm not able to answer that, but I can find someone who can. And here we have a professional way to respond when a patient asks a medical question outside of your scope. It sets a boundary clearly and respectfully while still offering to help by escalating the issue to someone qualified. Would you like a bit of time before we continue? Use this when a patient seems overwhelmed or upset. It's a great way to offer the patient space without being too pushy. It's okay to feel upset. This phrase normalizes the patient's reaction. It's short, kind, and powerful. Sometimes patients just need permission to cry or vent without feeling judged. Let me know if you prefer not to talk right now. This is a really thoughtful phrase that respects the patient's need for silence or for space. It shows emotional intelligence and gives the patient control over their interactions. I can stay with you until someone else arrives. Use this phrase when a patient is waiting for a doctor, a relative, or a difficult update. It shows presence and support, two things that are often more helpful than words. I'm here to support you in any way I can. This phrase is broad but comforting. It doesn't make any promises, but it shows that your role is more than physical care. It's about emotional presence too. We're doing everything we can to help. This sentence can bring reassurance in tense moments. It helps patients know that even if something can't be fixed instantly, action is being taken. And we say we here to reflect the whole team's effort. I'll stay with you while we wait. This phrase is great when patients are scared, in pain, or receiving care that takes time. Simply offering to stay can mean a lot, especially in unfamiliar or frightening environments. Every section in this lesson has an accompanying exercise in the PDF guide. If you're not a student member and want to check it out, it's available to purchase in my YouTube store, and it's also linked with this video. The exercise for the section on difficult conversations with patients is an AI role play you can upload to ChatGPT or Gemini and have a great conversation practice. Let's move on to section 8, handling mistakes and uncertainty. Now, everyone makes mistakes, even experienced nurses. What matters is how you respond. These phrases help you stay accountable, professional, and committed to learning when things don't go perfectly. I made an error and I want to report it properly. This phrase shows maturity and responsibility. Owning your mistake and reporting it through the proper channels is a key part of professional growth. I'm not sure about this. Can I double check it with you? This is a confident way to ask for clarification. I'm not sure doesn't mean you're failing. It shows that you're thoughtful and want to get it right. I think I missed a step. Can we go over it again? And here we have a great way for reflecting during or after a task. Missed a step keeps the tone gentle while still being honest. It opens the door to repeat learning without fear. I need more guidance on this process. This phrase tells your supervisor that you're keen to understand, not just complete the task. A bit more guidance is soft but clear and keeps you in the mindset of continuous improvement. I didn't feel confident doing that on my own. Use this statement after a procedure or when giving feedback to your mentor. It shows self-awareness and prioritizes patient safety over your own ego. It's always okay to say this. Could we talk through what went wrong? This phrase is helpful after a difficult situation or a mistake. Talk through sounds collaborative and solution-focused, not accusatory. It shows that you want to reflect and to improve. Next time, I'll try to approach it differently. This is a reflective phrase you can use when reviewing your own practice. It shows a growth mindset and signals that you're learning from every experience. I've taken note of that for next time. This is a great phrase to use when receiving constructive feedback. It shows that you're actively listening and integrating advice without becoming defensive. Thanks for the feedback. It really helps. This one is always useful after someone has corrected or guided you. This phrase keeps things positive and encourages your mentors to keep supporting your development. I'll add this to my reflective journal. This is a professional way to show that you're taking responsibility for your learning. Reflective journals are part of many nursing programs, and mentioning it signals that you're serious about growth. It's time to introduce my new friend, the Learning English Pro mascot. His name is Brainy. Brainy's here to give you lots of advice and additional tips to help you boost your professional English. And Brainy's first tip for you is probably the best for any English learner. Studies have shown that the best way to learn English is to talk about it with another English learner. So share this video with a colleague or friend, watch it together, practice and discuss the topics. This is a proven way to maximize your English learning. We are into our final 20 phrases of our lesson. Well done for getting this far. Section 9 is all about asking questions and clarifying. One of the best things you can do as a student nurse is to ask questions. These phrases help you seek clarification in a professional, respectful way without ever feeling like you're getting in the way. Could you explain why you're doing this? This is a great way to ask about the reasoning behind a task or treatment. Could you explain sounds polite and curious, not critical. It's an excellent phrase to show active learning. Is this the usual procedure for this situation? Use this question when you want to understand patterns and protocols. It shows that you're thinking beyond just copying actions. You're trying to understand the best practices. What would you do differently in this case? This phrase invites experienced colleagues to share their judgment. It's a fantastic way to learn how to adapt to specific patient needs and to build your own critical thinking. Can you walk me through the steps? This is a calm and professional way to ask for a breakdown of a process. Walk me through is more conversational than explain, and it works well when you're about to assist or try something new. Why do we monitor this so closely? This question shows that you're thinking about the purpose behind nursing actions. So closely adds focus, helping you understand risk factors and the importance of precision. What signs should I be looking out for? This fantastic question is especially helpful in patient monitoring. It signals that you're paying attention and want to learn what clinically matters. Do you have any tips for doing this more efficiently? Another great question here. Use this to ask for shortcuts or professional habits. Efficiently shows that you value time and effectiveness, which is essential in busy wards and hospitals. I'm not quite sure I understand. Could you show me again? This phrase is a gentle way to admit confusion without sounding lost. Not quite sure softens the sentence, and show me again signals that you're actively trying to get it right. I've read about this, but I haven't seen it done before. This phrase shows that you're prepared while acknowledging your inexperience. It's great to say before observing a new skill or a new procedure, as it encourages your supervisor to narrate or explain as they go. What would the risks be if we didn't do this step? Here is a very high-level question that shows critical thinking. It helps you understand not just the how, but the why. On the downloadable PDF guide, the exercise for this section is on page 34, and it's all about upgrading the question, how you can transform your basic English into sounding more clinical and more professional. If you've gotten this far into the lesson, well done to you. You're showing a lot of dedication to being a fantastic English speaker in a medical setting. At the end of your shift, it's important to close things off properly, hand over clearly, and reflect on what you've learned. Our final phrases help you wrap up your day professionally and mindfully. I've handed over everything to the next nurse. This is a clear and confident way to say you've transferred responsibility. It reassures your supervisor that you followed proper protocol. Is there anything else I should finish before I leave? Use this phrase to show responsibility and willingness. It helps you make sure nothing's been forgotten, and it shows that you value the smooth running of the shift. I'll tidy up my station before I go. This phrase signals professionalism and respect for the team. Keeping your area tidy helps the next shift and reflects pride in your role. Thanks for all your support today. You should use this statement to show your appreciation to your mentor, nurse, or anyone who's helped you during the day. Gratitude helps build strong relationships and leave a positive final impression. I learned a lot during this shift. Here we have a simple but powerful phrase. It shows that you're reflecting and growing. It's a great thing to say during debriefs or when thanking someone for their time. I found this part of the shift quite challenging. Use this phrase to reflect honestly. Quite challenging keeps the tone professional. It's a good entry point for constructive feedback or journaling. I want to practice that skill again soon. Here you're showing initiative, whether it's an injection, wound care, or communication task. Naming it helps your supervisor support your learning goals. What would you recommend I focus on next time? Here we have a fantastic question for mentors or preceptors. It turns the end of your shift into a coaching opportunity and helps you move forward in your development. I'll add that to my portfolio. If your course requires a skills log or reflection, this phrase shows that you're staying organized and taking your placement seriously. And now it's time for our final phrase, number 100. See you tomorrow. Have a good evening. And finally, this phrase is warm and professional. It ends your day on a positive note and shows that you're becoming a part of the team. Congratulations on finishing this lesson. You've just learned 100 English phrases every student nurse should know. And it's no small feat. It's like you've just done a mini course in medical English. Whether this is your first time or your fifth time watching this lesson, I encourage you to come back for more. If you found this course useful, consider joining the student membership where all PDFs are available as part of the membership fee. Hi, I'm Jer from Learning English Pro, and this is 100 English Phrases for Medicine, Medication, Prescriptions, and Patient Instructions. This lesson is packed with clear, professional phrases for healthcare workers like nurses, doctors, and pharmacists, from giving dosage instructions to explaining side effects. If you'd like to study these phrases in more detail, there is a full extensive guide for this lesson, which includes language tips for each phrase, a glossary, and 3 additional exercises to boost your comprehension. It's available to all my student members, and it's also available in the YouTube store for just $4.99. Let's get started. Our first category of phrases is prescribing medication. I'm prescribing you this medication for your symptoms. Take 1 tablet twice a day. This is a long-term medication for chronic conditions. You will need to take this medication regularly. This medication should help reduce your symptoms. I'll write you a prescription for pain relief. Start with a low dose and increase as needed. This medication is only available by prescription. You'll need a refill every month. Take it exactly as directed. Great start. These phrases are essential when prescribing medication. Next, let's talk about how to explain dosage and timing to patients. If you're finding these phrases helpful, hit the like button and subscribe for more. Take 1 pill every 8 hours. Take it on an empty stomach. You should take it before meals. Take it with plenty of water. Don't exceed 4 doses in 24 hours. Take this medication only when needed. Space out the doses evenly. Take it at the same time each day. If you miss a dose, take it as soon as you remember. Do not double the dose if you miss one. Well done. Clear instructions about dosage and timing are crucial for patient safety. Now, let's move on to discussing side effects. If you'd like to see more lessons like this, join the student membership to support the channel and get access to the guide that comes with this lesson. You may experience mild drowsiness. This medication might cause nausea. Contact us if you experience any side effects. Stop taking it if you develop a rash. Some patients report headaches. You may feel dizzy after taking this. Dry mouth is a common side effect. Rarely, it can cause blurred vision. Report any unusual symptoms immediately. Most side effects are temporary. Knowing how to explain side effects clearly helps patients manage their expectations. Up next, we'll cover administering medication. And leave a comment if you found any of these phrases useful so far. I'm going to give you an injection. This will be administered intravenously. We'll start the infusion slowly. You'll feel a small pinch. I'll insert the IV into your arm. The medication will be delivered through a drip. I'm going to adjust the dosage. We'll monitor you during the infusion. Let me know if you feel any discomfort. You might feel a slight burning sensation. Great job! Administering medication safely is key. Next, let's talk about patient instructions. And remember to subscribe for more professional medical English lessons. Take your medication exactly as prescribed. Do not share your medication with anyone. Keep your medication out of the reach of children. Store it at room temperature. Do not crush or chew the tablets. Follow the dosage instructions carefully. Finish the full course, even if you feel better. Take your medication with a meal if it upsets your stomach. Avoid alcohol while taking this. Keep a medication diary to track doses. Giving clear instructions helps patients stay safe and compliant. Next, let's discuss medication safety. Don't forget to give this video a thumbs up if you're finding it helpful. Always read the label before taking any medicine. Check the expiration date before use. Store in a cool, dry place. Keep your medication in its original packaging. Don't use if the seal is broken. Dispose of expired medication safely. Never mix medication without consulting a doctor. Avoid self-medicating without guidance. Keep a list of all your current medications. Inform us if you're taking herbal supplements. Wow, safety first. Now let's cover medication adherence and why it's so important. If you're still watching, leave a comment saying "got it" to let me know you're following along. Have you been taking your medication regularly? It's important not to skip doses. Let me know if you're having trouble sticking to your schedule. Use a pill organizer to stay on track. Set a reminder for your next dose. Don't stop the medication without consulting us. Consistency is key for effective treatment. Follow the treatment plan strictly. Keep track of your doses to avoid missed ones. Let us know if you're experiencing difficulty. Well done, you're doing awesome. Let's move on to our 8th topic, drug interactions. Inform your doctor about all the medications you are taking. Avoid combining this with alcohol. Do not take this medication with grapefruit juice. Some antibiotics may reduce the effectiveness of birth control. Check for potential interactions with your current medications. This medicine may interact with blood thinners. Let us know if you are taking any over-the-counter supplements. Be cautious when combining this with pain relievers. Consult your pharmacist about possible interactions. This medication can increase the effects of sedatives. Great, understanding drug interactions is crucial to patient safety. Now, let's move on to follow up on medication, which helps ensure ongoing care and effectiveness. If you want to explore these phrases even further, check out the guide for this lesson. It's full of additional language tips for every single phrase. The guide is available for student members over on the Student Membership tab, and it's also for sale in my YouTube store. How are you feeling after starting the new medication? Have you noticed any changes since beginning treatment? Are you experiencing any side effects? Have you been taking the medication as prescribed? Is the medication helping with your symptoms? Do you feel any improvements since the last visit? Are you having any trouble remembering to take your doses? Have you needed to use any additional pain relief? Would you like advice on managing your medication schedule? Let's review your medication plan together. Excellent. Following up on medication helps ensure that treatment is working as expected. Now for our final section, if you got this far, well done. We're going to cover education and advice for medication. Always complete the full course, even if you feel better. Store your medication in a secure place. Keep a list of your medications in your wallet. Inform your pharmacist if you are pregnant or breastfeeding. Do not share your medication with anyone else. Educate yourself about possible side effects. Read the patient information leaflet thoroughly. Take your medication as directed to avoid complications. Contact us if you're unsure about your dosage. Keep a journal of your symptoms while on this medication. And that's it, 100 essential phrases for medication. I hope you found these phrases practical and useful for your work in healthcare. And if you'd like more in-depth explanations, check out the downloadable guide for this lesson. It includes a glossary and exercises to practice these phrases. It's available to student members for just $4.99 per month, which also grants you access to all my lesson guides, my video archive which contains 200 lessons, and much more. You can also get this guide as a one-time purchase in the YouTube store for $4.99. If you've enjoyed this lesson, like, subscribe, and leave a comment with your thoughts or any other medical topics you'd like me to cover. Sharing this video with colleagues or fellow healthcare learners really helps support the channel. Thanks for watching and learning with me. Stay safe, keep practicing, and I'll see you in the next lesson. I'm Jer. Let me ask you something. Do you speak English properly? Probably yes, but do you deliver your English with emotional intelligence, empathy, and kindness, the kind that your patient deserves, especially when they feel vulnerable, are in pain, or confused? And let's face it, as a non-native English speaker, you already face some uphill challenges. Some patients wrongly may assume things about your professionalism based on your fluency and your accent. But don't worry, here's where it gets better. In this video, I've put together 20 phrases every doctor should know, but you will gain extra depth with this lesson as I will go into emotional intelligence, delivery, gesticulation, and everything that you need to really connect with your patients. This isn't your typical English lesson. I'm not going to throw every phrase at you. I'll guide you through exactly how to say each one with emotional intelligence and clarity. And if you want to go even deeper into this subject, I've crafted an entire guide for this lesson. It's something I'm really proud of, and it really builds on everything that we've covered here today. I've written an article referencing lots of medical journals to show the importance of emotional intelligence as a doctor in your delivery in English. All the phrases are covered with additional tips that give you insight into the nuance and the grammar and vocabulary. I've also included 3 different exercises which will help you build to a point where you're able to create your own sentences that offer reassurance and guidance to your patients. This guide is available to student members as part of your membership, and it's available right now on the membership tab. But if you just want to buy it as a one-time download, it's also available for €4.99 on my YouTube store. So head over there and grab a copy. So let's dive right into our format. I'm going to deliver each phrase quite flatly so you can understand and hear the vocabulary and the grammar that is in use. I'll give you a context for each phrase, and then I'll deliver the phrase to you with what I think is emotional intelligence, with tone, gesticulation, and with kindness. I'll also break down why I'm delivering the phrase in the way I am and the impact it will have on the patient. So stay tuned, grab a notebook, download the guide, and let's get started. So here's phrase 1 delivered quite flatly. Don't worry, Mrs. Smith. It's happened to the best of us. So the context of the situation and why we may say it to the patient is that the patient has created a mess, something like they have vomited everywhere, or they have pooped everywhere, or peed everywhere. A very vulnerable and humiliating experience. We really want to put the patient at ease. So let's deliver it with some emotional intelligence and a little bit of kindness. Don't worry, Mrs. Smith, it's happened to the best of us. So what we're doing with this phrase is, firstly, we are normalizing the situation. We are saying that this situation, vomiting, pooping, peeing, can happen and does happen to everyone. It's a very human experience. Using the patient's name here also adds a connection. It reinforces what you're saying. This phrase is really saying, I see your shame. I'm not meeting it with judgment. I'm meeting it with humanity. And it's a great way to make a connection with the patient and put them at ease. For our next phrase, we're staying with an embarrassing context. So the situation might have moved on, but there is a shame that lingers. So what can we say to the patient in this moment? When you say it quite flatly, it almost sounds like a bit of a threat. Listen up. You're not the first person this has happened to, and you won't be the last. It does sound a little bit threatening when you say it quite flatly, but when we deliver it with a little bit more nuance, it comes across entirely different. You're not the first person this has happened to, and you won't be the last. It's important here to impart empathy and not sympathy. What you're really saying is that you've seen this lots of times before, but you understand how upsetting it is. You're not brushing it off. You're validating the experience and their emotions. While, like phrase 1, you're grounding it in humanity. Ready for phrase number 3? So let's imagine the context for this phrase. A patient is telling you a particularly sad story, maybe about a misdiagnosis or a period of pain or some personal hardship. This mightn't be a time for you to jump in and try and fix everything. You want to continue listening. So our next phrase is perfect for that. That must have been really difficult for you. But let's add some kindness, some tone, and some gesticulation. That must have been really difficult for you. So as I mentioned, this is a listening phrase. We're not jumping in with a fix, we are validating pain. And saying the phrase must have been is very powerful. It's empathy without assumption. Now it's your turn. Try and say it flatly. It just doesn't sound right, does it? But soften your face, use a little bit of gesticulation, and say it how you might want a doctor to say it to you if you were feeling like this in this situation. Always place yourself in the patient's shoes. Sometimes after hearing a bad experience that a patient has had, it's time to offer encouragement. And our next phrase does that beautifully. Here it is in a flat tone. All things considered, you're doing really well. But let's add some humanity to this phrase. All things considered, you're doing really well. So that little bit of head movement adds more nuance and more empathy to this phrase. All things considered is a nice little phrase because you're not really adding judgment to what's happened. You're not saying that's awful, that's terrible. You're not adding on weight to the situation, but you're saying with everything that has happened, you're handling it really well. This isn't an empty phrase. All things considered means I see your journey, I see your pain, and I recognize you. It's really contextual kindness. Now don't forget, all the phrases covered in this lesson are in the guide, and the guide offers additional tips on each phrase. Let's move on to phrase number 5, which is great for when things feel very overwhelming. Delivered in a flat tone, it is, let's take this one step at a time. Now this phrase can be used when you're explaining a diagnosis or you're listening to a story and there is a lot to cover. But let's add some nuance. Let's take this one step at a time. The action of using your hand here is helping to calm the patient and settle the environment. This phrase is all about co-regulation. You're using your words to calm the patient down. And using the word let's means that you're in it together. It's a word that combines both yours and your patient's efforts together in a team. And with this phrase, you could probably slow it down as you get towards the end of it. Let's take this one step at a time. It's calming, it's reassuring, and it helps set the structure going forward. So we've covered 5 phrases so far. Which one of them is your favorite, and which one of them do you think you'll use first? Let me know in the comments. I'd love to hear from you. Phrase number 6 is a nice short one. Delivered flatly, it is, that reaction is completely normal. But with some nuance, we can really reassure a patient in a moment where they've had an embarrassing reaction like crying, screaming, anything like that. That reaction is completely normal. This is a lovely, calming phrase, and again, we are normalizing the situation. We are saying, this is a hospital, this kind of stuff happens here all the time. Being slow here in the delivery is really important. It imparts a safe environment for the patient. Let's move on to something that makes patients feel really vulnerable, their guilt. Sometimes they feel they ask too many questions, are too much in the way, or showing too much emotion. And this phrase offers reassurance and a little bit of humor. Let's listen to it in a flat tone. It really is no problem. It's what I'm here for. But with a little bit of nuance, the phrase completely transforms. It really is no problem. It's what I'm here for. And what you're saying in the sentence is, you as a patient are not a burden. This is literally my job. My job is to take care of you. Adding a smile and a little bit of a chuckle to, it's literally my job, is quite appropriate here. Don't just say you're happy to help. Show it in your tone. Wait and see if someone apologizes 3 times for something and then say it. See the impact that it has. I bet you'll see a positive outcome. We are already on phrase 8, you guys. We're doing really, really well. So from phrase 7, we had guilt, And now we're going to move into uncertainty. Let's focus on what we can do right now. So said like this, it actually sounds quite commanding and sharp. Let's add in some kindness. Let's focus on what we can do right now. So with this phrase, you're carrying some authority. You're directing the patient to be more focused and not to panic. Again, we are using inclusive language with the word let's. Let's work together on this. Let's focus on the main thing that we need to focus on and try to push aside any worries or upset for the moment. It's calm and it's reassuring. The phrase has a soothing rhythm. Let it breathe as you say it. Let's focus on what we can do right now. It has a lovely flow. Say this to a patient when they're in full panic and see how it goes. Now let's go deeper into feelings when a patient is really struggling, perhaps even after you've explained everything. It's perfectly normal for you to feel this way. Sounds really robotic, doesn't it? Let's add some human kindness. It's perfectly normal for you to feel this way. So again, we're adding gesticulation, we're adding tone and softness to our voice and our face. So here you want your voice to be really calming and soothing. And of course, you want to be reassuring and not patronizing. So adding that softness to your voice really helps here. This is great in a situation where a patient is holding back their emotions and trying to stay strong. You're giving them permission to feel their feelings. Let's move on to phrase 10, our halfway point. Well done for getting this far. Imagine the scenario. You're standing at a patient's bed. They're about to go in for a big, scary surgery. What do you say? Well, said flatly, our next phrase sounds dreadful. We have a fantastic team here. You're going to be really well taken care of. Said flatly, it does sound quite funny and a little bit threatening again, but with a little bit of flair and kindness, we can use this phrase to really reassure a patient going into a big, scary situation. We have a fantastic team here. You're going to be really well taken care of. A big tip here would be not to put on too much of a big smile. You don't want to come across as fake and have the phrase sound rehearsed. And a subtle gesture to nurses or the team that is working around is a nice little add-on to this phrase. So our next phrase takes us directly into the procedure with the patient, where they're scared, they're confused, they're uncertain about what is happening in the moment. This is your opportunity to calm the situation and really help the patient. Let's listen to the phrase in a flat tone. I know you're worried. Let me explain what's happening. Now let's try the phrase again, but this time with some emotional intelligence. I know you're worried. Let me explain what's happening. This phrase is a pairing of emotional recognition and logical support. It validates first and then assures with clarity, and it's layered beautifully. I know you're worried, which is emotionally attuned, and let me explain. Proactive comfort. Use this phrase when you see the anxiety before it's verbalized. It's about reading the room and creating a sense of calm for the patient. Our next phrase deals with a scenario where a patient might need some reassurance about their decision to come in. Sometimes a patient will feel that they shouldn't have come into hospital or into the clinic. They might feel like they're wasting your time. And this is a great little phrase that you can use to reassure them. You did the right thing coming in. Adding some human spice, we would say, you did the right thing coming in. This phrase is all about firm kindness, and it's a little bit like your teacher saying to you, I'm proud of you. And a little bit of a nod affirms what you're saying. A nice little follow-up here would be, always come in if you're worried. That really seals it. Sometimes patients carry guilt for needing care. This phrase lifts it, reaffirms your role, and builds real trust with your patient. Over the course of your professional career, you're going to come across patients with embarrassing conditions like UTIs, STIs, or perhaps bowel problems. Our next phrase is the gateway to disclosure and having an open, honest conversation without any judgment. Now here it is in its flat tone. We see this all the time. There's no need to be embarrassed. Now, said in this flat tone, it sounds quite robotic, but said with a little bit of kindness and human emotion, we can really use it as a great tool to put the patient at ease and to normalize the situation. We see this all the time. There's no need to be embarrassed. Your tone here needs to be confident and not flippant. You're saying this is normal without dismissing the situation. This phrase will help the patient feel like they're not the only one and feel less stigmatized. And that's really where healing starts. But sometimes it's not about what the patient can say, it's about what they can't say, and we need to give them some space. Phrase number 14 does that perfectly. Would you like a moment before we continue? Let's add some special sauce to this phrase, and probably best to lean in a little bit with this phrase. Would you like a moment before we continue? So we want to lower our tone, lower our pace, and speak a bit slowly here. It's all about creating a safe space for the patient. Pause after saying this phrase. The silence is part of the comfort. It's important to note that emotional regulation is not all about words. Sometimes it's about the silence. Phrase number 15, well done, people. And don't forget to check out the guide that comes with the student membership. The link to join is in the video description, or you can head over to the YouTube store to pick up your copy right now. Sometimes patients will have bad habits that may contribute to their symptoms, like smoking. But you as a doctor, you're not here to judge, you're here to guide. And our next phrase really does a good job of doing that. Said flatly, it is, you don't need to explain yourself to me. Said like this, it almost sounds offensive, but by adding a little bit of gesticulation and humanness, we can really make the phrase super, super useful. You don't need to explain yourself to me. We say this softly with no defensiveness. This phrase is all about releasing shame. What you're saying is, you're here now, that's what matters. Let's deal with the situation at hand. I'm not here to judge you. And it doesn't just remove that judgment, it removes the fear of judgment. It's a great, great phrase to use. So how about if we have a serious illness that the patient is confronted with? Our next phrase is useful for building the doctor-patient team that makes the patient feel less alone. And alone is a key word in the phrase. Delivered with no emotion, the phrase is, you're not alone in this, I'll be with you every step of the way. This phrase needs to be paced with deep care. You're not alone in this. I'll be with you every step of the way. See how my pacing is much slower here. I take a little break in the middle, and my gesticulation almost hints at the steps that are coming. Here you are speaking with authority, but you are placing you and the patient together, and you're specifically stating, you are not alone in this. I am with you. It's a powerful statement that you can share with your patient in a very difficult moment. And with the diagnosis comes a whole load of different emotions that a patient can feel, especially guilt or shame. This is your opportunity to help reassure them when you see their guilt forming. Now, said flatly, the phrase is, please know this is not your fault. But said with some human emotion and kindness, the phrase transforms. Please know this is not your fault. It's firm, it's reassuring, you're speaking from a place of authority, but it's filled with kindness. Starting with the phrase, please know, is like you're handing something nice to them. And following up with, it's not your fault, is just a nice way to reassure someone. So once we've removed guilt and reassured the patient, what happens next? They may want to ask lots and lots of questions about treatment or diagnosis or prognosis. So this is where our next phrase comes in real handy. Said with a flat tone, it's okay to ask as many questions as you need. Let's add some emotional intelligence to this phrase. It's okay to ask as many questions as you need. So here we're gesticulating with some open hand gestures and really showing ourselves open as a fountain of knowledge for the patient to really explore. This phrase is all about removing the power imbalance that some patients may perceive in the doctor-patient relationship with you. It shifts the room from Doctor Knows Best to We're in this together. We are coming very close to the end of our lesson. Thank you so much for sticking around. I hope you're enjoying it as much as I am. Make sure to comment below with what your favorite phrase is right now. Which one would you use first in your day-to-day work? Our final two phrases can be used in combination, and they deal with a particularly difficult subject when it comes to emotional intelligence. These next two phrases are all about delivering the news of a terminal diagnosis to a patient, one of the most difficult things a doctor or any human can do. This is the most important time when you have to say something clearly but not coldly. So let's listen to phrase 19. Here's the phrase said flatly. I'm afraid, Mary, the news isn't good. The test results show that the cancer is at stage 4 and has spread. This phrase is a difficult one for anyone, but let's try and add some kindness and some compassion. I'm afraid, Mary, the news isn't good. The test results show that the cancer is at stage 4 and has spread. Using I'm afraid here is a forewarning and prepares the patient for the bad news. Using slow, gentle pacing as you deliver this sentence is important, as it gives the patient time to absorb the news. You want to make sure that you maintain eye contact and deliver it with confidence and clarity. That's what the patient deserves. You've delivered the bad news, and now it's time to give the prognosis, how much longer the patient has to live. This is probably the hardest part of delivering this type of news. Let's listen to the phrase in a flat tone. For this type of diagnosis, the average we are looking at is about 6 months. From now, our focus is on comfort, dignity, and support. Let's soften up this phrase with some kindness and human compassion. For this type of diagnosis, the average we're looking at is about 6 months. From now on, our focus is on comfort, dignity, and support. This phrase isn't just about clinical clarity. You have just introduced a whole load of chaos and overwhelming information into a patient's life. And this phrase offers a structure, a roadmap going forward. This phrase should be said like a slow breath, allowing the patient to absorb each part without being overwhelmed. With this phrase, and like all the others, it's not just about the words. It's how you hold space for them, how you emote them in your face, through your hands, and through your speech in its tone and its clarity. I hope you've enjoyed learning these different phrases and how to really tune in to your emotional intelligence. I know it's something that you have in your own native language, but it can be difficult to really project that when you're learning English and it's not your mother tongue. Don't forget to download the guide for this lesson. It's something I'm really proud of, and it really builds on everything that we've covered here today. I've written an article referencing lots of medical journals to show the importance of emotional intelligence as a doctor in your delivery in English. All the phrases are covered with additional tips that give you insight into the nuance and the grammar and vocabulary. I've also included 3 different exercises which will help you build to a point where you're able to create your own sentences that offer reassurance and guidance to your patients. This guide is available to student members as part of your membership, and it's available right now on the membership tab. If you haven't signed up yet and want to take a look, you can buy this guide on the YouTube store. Head over there right now. Everything is linked in the video description. Hello, you're very welcome to Learning English Pro. In this lesson, we will follow Nurse Jer through a full hospital shift. We'll listen to 10 real-world conversations between nurses and patients across one busy workday. Each conversation will play twice, first with subtitles, then again with on-screen questions. The answers to the questions will appear right after. There are 23 questions in total. Track your score and post it in the comments. And how about challenging a colleague to beat your score? The full transcript and learning guide for this lesson is available exclusively to my student members. Student membership with Learning English Pro is just $4.99 a month and includes access to my PDF and video libraries, early access to new lessons, and priority for your video requests. Join the student membership today to support the channel. And don't forget to like, comment, and subscribe. Let's get started. It's the start of Nurse Jer's shift. He's just arrived on the ward and meets with the night nurse to get the handover. Listen carefully. There's key information about one of today's main patients.
Morning, Jer. Let's start the handover.
Morning. Thanks. How was the night?
Fairly calm overall. No new admissions and no major emergencies. One important update, though. Mrs. Murphy in room 303 had an episode of chest pain around 2 a.m.
Oh no, is she okay now?
She's stable. I gave her a sublingual nitroglycerin tablet as per protocol. Her blood pressure at the time was 160/95, but it came down to 130/80 by 3 a.m. Her pulse is steady at 78.
Okay, good. Any signs of recurrence?
None so far. She's alert, responsive, and resting comfortably now. She says she feels fine this morning.
That's a relief.
Dr. Smith reviewed her chart early this morning and ordered a chest x-ray for later today, more precautionary than urgent.
Got it. I'll check if the request is in the system and follow up with radiology.
Perfect. Oh, and she has no known drug allergies in case it comes up.
Thanks. Anything else I should know?
Not really. Just the usual meds and morning observations across the board. Charts are up to date.
Brilliant. Thanks for the thorough handover.
No problem. Have a smooth shift.
You too. Get some rest.
Morning, Jer. Let's start the handover.
Morning. Thanks. How was the night?
Fairly calm overall. No new admissions and no major emergencies. One important update, though. Mrs. Murphy in room 303 had an episode of chest pain around 2 a.m.
Oh no, is she okay now?
She's stable. I gave her a sublingual nitroglycerin tablet as per protocol. Her blood pressure at the time was 160/95, but it came down to 130/80 by 3 a.m. Her pulse is steady at 78.
Okay, good. Any signs of recurrence?
None so far. She's alert, responsive, and resting comfortably now. She says she feels fine this morning.
That's a relief.
Dr. Smith reviewed her chart early this morning and ordered a chest x-ray for later today, more precautionary than urgent.
Got it. I'll check if the request is in the system and follow up with radiology.
Perfect. Oh, and she has no known drug allergies in case it comes up.
Thanks. Anything else I should know?
Not really. Just the usual meds and morning observations across the board. Charts are up to date.
Brilliant. Thanks for the thorough handover.
No problem. Have a smooth shift.
You too. Get some rest.
With the handover complete, Nurse Jer joins his colleague Anna to plan the morning tasks. They mention a student nurse, a patient with overnight symptoms, and something that could affect the whole day.
Morning, Jer. You made it through the fog. I nearly turned back twice.
Morning. I know, it was thick out there. Thought I'd need a lighthouse to find the hospital.
Glad you're here. I've just grabbed the patient charts. Shall we take a quick look together?
Sure, I've had the handover from O'Connell. Mrs. Murphy had chest pain in the night. She's stable now, but Dr. Smith has ordered a chest x-ray.
Got it. I'll check if radiology has confirmed the scan slot. Let's keep an eye on her vitals this morning.
Absolutely. Also, we've got Aisling with us again, the student. She's on our team today.
Oh, brilliant. I actually really like working with her. She's eager, but she still needs a bit of hand-holding.
Yeah, and she nearly gave the wrong morphine dose last week. Caught it in time, thank God.
Right. So we supervise everything she charts today. Maybe let her shadow you during morning meds.
Good idea. I'll loop her in when I do Mrs. Murphy's rounds.
Perfect. Anything else flagged in handover?
Just the usual. No new admissions overnight. O'Connell said charts are up to date.
Then let's divide the rooms and get cracking. If we move quickly, we might actually get a lunch break today.
Ambitious? But I like it. Let's do it.
Morning, Jer. You made it through the fog. I nearly turned back twice.
Morning. I know, it was thick out there. Thought I'd need a lighthouse to find the hospital.
Glad you're here. I've just grabbed the patient charts. Shall we take a quick look together?
Sure, I've had the handover from O'Connell. Mrs. Murphy had chest pain in the night. She's stable now, but Dr. Smith has ordered a chest x-ray.
Got it. I'll check if radiology has confirmed the scan slot. Let's keep an eye on her vitals this morning.
Absolutely. Also, we've got Aisling with us again, the student. She's on our team today.
Oh, brilliant. I actually really like working with her. She's eager, but she still needs a bit of hand-holding.
Yeah, and she nearly gave the wrong morphine dose last week. Caught it in time, thank God.
Right. So, we supervise everything she charts today. Maybe let her shadow you during morning meds.
Good idea. I'll loop her in when I do Mrs. Murphy's rounds.
Perfect. Anything else flagged in handover?
Just the usual. No new admissions overnight. O'Connell said charts are up to date.
Then let's divide the rooms and get cracking. If we move quickly, we might actually get a lunch break today.
Ambitious? But I like it. Let's do it.
Nurse Jer heads straight to room 303 to check on Mrs. Murphy. It's his first interaction with her today. Listen closely to how he combines care with clinical accuracy.
Good morning, Mrs. Murphy. How did you sleep?
Not too bad, dear. A little restless, but I'm feeling better now.
I'm glad to hear that. I heard you had some chest discomfort during the night.
Yes, it was a bit frightening, but after the tablet, it settled quickly.
That's great. You did the right thing letting the night nurse know. I've just checked your handover notes. Your blood pressure and pulse are looking steady this morning. Let me take them again quickly, all right?
Of course, go ahead.
Okay, blood pressure is 128/78, and your pulse is 76. Looking very stable.
That's good to hear. I do feel better.
Here are your morning medications. Your aspirin, vitamin D, and something for the slight joint pain you mentioned yesterday. Take them with this glass of water.
Thank you. You're very kind.
You're welcome. Oh, and just so you know, radiology will be coming by later to do a chest x-ray. The doctor just wants to be thorough.
Will it hurt?
Not at all. It's painless and only takes a few minutes. I'll check in after the scan.
Thank you, nurse. I really appreciate you taking the time.
Good morning, Mrs. Murphy. How did you sleep?
Not too bad, dear. A little restless, but I'm feeling better now.
I'm glad to hear that. I heard you had some chest discomfort during the night.
Yes, it was a bit frightening, but after the tablet, it settled quickly.
That's great. You did the right thing letting the night nurse know. I've just checked your handover notes. Your blood pressure and pulse are looking steady this morning. Let me take them again quickly, all right?
Of course, go ahead.
Okay, blood pressure is 128/78, and your pulse is 76. Looking very stable.
That's good to hear. I do feel better.
Here are your morning medications. Your aspirin, vitamin D, and something for the slight joint pain you mentioned yesterday. Take them with this glass of water.
Thank you. You're very kind.
You're welcome. Oh, and just so you know, radiology will be coming by later to do a chest x-ray. The doctor just wants to be thorough.
Will it hurt?
Not at all. It's painless and only takes a few minutes. I'll check in after the scan.
Thank you, nurse. I really appreciate you taking the time.
Something's gone wrong. Student nurse Aisling pulls Nurse Jer aside with a confession. This moment could impact patient safety or become a learning opportunity.
Jer, can I speak to you for a second? I think I've made a mistake in one of the charts.
Of course, what happened?
It's about Mrs. Murphy's medication record. I accidentally documented 5 milligrams of morphine instead of 0.5 milligrams from last night's dose. I realized it right after writing it, and thankfully, she was never given the wrong dose.
Okay, take a breath. You spotted the error yourself, which is really important. Let's go correct the record and let the senior nurse know so the doctor is aware.
I've never done that before. I feel terrible.
Mistakes happen. What matters is how you handle them. This is why we double-check everything. It's part of learning.
Thanks for being understanding. I'll be more careful moving forward.
I know you will. Let's fix it now and keep going. You've got this.
Jer, can I speak to you for a second? I think I've made a mistake in one of the charts.
Of course, what happened?
It's about Mrs. Murphy's medication record. I accidentally documented 5 milligrams of morphine instead of 0.5 milligrams from last night's dose. I realized it right after writing it, and thankfully, she was never given the wrong dose.
Okay, take a breath. You spotted the error yourself, which is really important. Let's go correct the record and let the senior nurse know so the doctor is aware.
I've never done that before. I feel terrible.
Mistakes happen. What matters is how you handle them. This is why we double-check everything. It's part of learning.
Thanks for being understanding. I'll be more careful moving forward.
I know you will. Let's fix it now and keep going. You've got this.
It's time for teamwork. Nurse Jer brings Aisling and Anna together to handle the situation. Listen for how they communicate under pressure while staying supportive.
Anna, quick update. Aisling found a documentation error from last night.
All right, what happened?
I recorded 5 milligrams of morphine instead of 0.5 milligrams in Mrs. Murphy's chart. I noticed the mistake straight away and corrected it in my notes, but it's still on the official chart.
Thanks for being honest, Aisling. We'll need to update the chart properly and add a note about the correction.
And inform the medical team as well. Better they hear it from us.
Absolutely. It's a learning moment. You handled it well by owning up immediately.
I feel bad, but I really want to improve.
And you will. For now, let's correct the record and move on.
After that, Aisling, why don't you join me while I prep Mrs. Murphy for her x-ray? You'll get to see the patient handling protocol.
I'd love to. Thank you both.
Anna, quick update. Aisling found a documentation error from last night.
All right, what happened?
I recorded 5 milligrams of morphine instead of 0.5 milligrams in Mrs. Murphy's chart. I noticed the mistake straight away and corrected it in my notes, but it's still on the official chart.
Thanks for being honest, Aisling. We'll need to update the chart properly and add a note about the correction.
And inform the medical team as well. Better they hear it from us.
Absolutely. It's a learning moment. You handled it well by owning up immediately.
I feel bad, but I really want to improve.
And you will. For now, let's correct the record and move on.
After that, Aisling, why don't you join me while I prep Mrs. Murphy for her x-ray? You'll get to see the patient handling protocol.
I'd love to. Thank you both.
After a hectic morning, Jer and Anna grab a quick lunch. The mood is lighter, but you'll hear them reflect on the team, the patients, and the ups and downs of the shift so far.
Finally, lunch. I swear my stomach's been grumbling for 2 hours.
Same here. If anyone's earned a sandwich today, it's you.
And you. Mrs. Murphy's vitals were excellent after her scan. By the way,
That's great news. She seemed more at ease when I checked on her mid-morning.
I think she trusts you. She called you a right gentleman when I walked in.
Did she? I'll take that. She's sweet.
And Ashling's doing much better this afternoon. You handled her mistake earlier really calmly.
She's got potential. She just needs someone to believe in her.
That's why you're so good at this.
All right, let's not get too sentimental. It's chicken soup today and I don't want to cry into it.
Ha, fair. Let's eat before the next call bell rings. Finally, lunch. I swear my stomach's been grumbling for 2 hours.
Same here. If anyone's earned a sandwich today, it's you.
And you. Mrs. Murphy's vitals were excellent after her scan. By the way,
That's great news. She seemed more at ease when I checked on her mid-morning.
I think she trusts you. She called you a right gentleman when I walked in.
Did she? I'll take that. She's sweet.
And Ashling's doing much better this afternoon. You handled her mistake earlier really calmly.
She's got potential. She just needs someone to believe in her.
That's why you're so good at this.
All right, let's not get too sentimental. It's chicken soup today and I don't want to cry into it.
Ha, fair. Let's eat before the next call bell rings.
The afternoon brings new updates, new tasks, and a sign that one of the patients may be going home soon, but there's still work to do and teamwork remains essential.
All right, Anna, just came from radiology. They've uploaded Mrs. Murphy's scan.
Perfect. I'll have a look in a second. Have you updated the progress notes?
Just finished. Her vitals are steady and she's reporting no pain. I think we can recommend her for discharge in the morning.
Great. And I heard Ashling managed the IV on patient 305 solo. That's a big step.
She did well. Very precise. I supervised but didn't have to step in.
Fantastic. She'll make a good nurse, I think.
I agree. Anything else on your side?
Just one lab result to chase up. Would you mind double-checking the medication chart in room 304 while I call the lab?
No problem at all. Let's meet back here in 10.
Deal. Let's wrap this day up strong.
All right, Anna, just came from radiology. They've uploaded Mrs. Murphy's scan.
Perfect. I'll have a look in a second. Have you updated the progress notes?
Just finished. Her vitals are steady and she's reporting no pain. I think we can recommend her for discharge in the morning.
Great. And I heard Ashling managed the IV on patient 305 solo. That's a big step.
She did well. Very precise. I supervised but didn't have to step in.
Fantastic. She'll make a good nurse, I think.
I agree. Anything else on your side?
Just one lab result to chase up. Would you mind double-checking the medication chart in room 304 while I call the lab?
No problem at all. Let's meet back here in 10.
Deal. Let's wrap this day up strong.
Nurse Jer checks in on Mrs. Murphy later in the day. She's feeling better, but is it enough to go home? Listen closely for clinical decisions and emotional reassurance.
Hello again, Mrs. Murphy. I just read the radiology report. Looks like everything's clear.
Oh, that's such a relief. I was worried it might be something serious.
Nothing alarming at all. Your chest scan came back normal, and your vitals have been consistently good.
So what happens next?
Dr. Smith will review everything this evening, but if you remain stable, we'll likely discharge you tomorrow.
That's music to my ears. I've been craving my own bed and a proper cup of tea.
We'll get you there soon. Just take it easy tonight, and I'll check on you again before my shift ends.
Thank you, nurse. You've all been wonderful.
It's been our pleasure. Hello again, Mrs. Murphy. I just read the radiology report. Looks like everything's clear.
Oh, that's such a relief. I was worried it might be something serious.
Nothing alarming at all. Your chest scan came back normal, and your vitals have been consistently good.
So what happens next?
Dr. Smith will review everything this evening, but if you remain stable, we'll likely discharge you tomorrow.
That's music to my ears. I've been craving my own bed and a proper cup of tea.
We'll get you there soon. Just take it easy tonight, and I'll check on you again before my shift ends.
Thank you, nurse. You've all been wonderful.
It's been our pleasure.
Aisling approaches Jer with confidence. She's completed a task and wants to do more. Has she turned things around? Listen for growth, initiative, and trust.
Jer, just a quick update. I reviewed all the vitals for rooms 301 to 305, and everything's logged correctly.
Excellent work. You've been really on top of things this afternoon.
Thanks. I also reviewed Mrs. Murphy's discharge protocol, just in case she gets the green light tomorrow. Could I help with that process if she does?
Absolutely. I'll walk you through the documentation and pharmacy steps when the time comes. Good initiative.
I've learned so much today. I feel more confident now, even after this morning.
That's the sign of a great nurse. Resilience and willingness to learn.
I appreciate your guidance.
Keep this up, Aisling. You're doing really well.
Jer, just a quick update. I reviewed all the vitals for rooms 301 to 305, and everything's logged correctly.
Excellent work. You've been really on top of things this afternoon.
Thanks. I also reviewed Mrs. Murphy's discharge protocol, just in case she gets the green light tomorrow. Could I help with that process if she does?
Absolutely. I'll walk you through the documentation and pharmacy steps when the time comes. Good initiative.
I've learned so much today. I feel more confident now, even after this morning.
That's the sign of a great nurse. Resilience and willingness to learn.
I appreciate your guidance.
Keep this up, Aisling. You're doing really well.
The shift is nearly over. Nurse Jer and Anna check what's left and reflect on the day. It's not just about the charts, it's about the people.
Well, that's us nearly done. Charts are up to date, and Mrs. Murphy's set for possible discharge tomorrow.
And Aisling came full circle today. She handled that patient handoff earlier like a pro.
She really did. Big improvement in just a few hours.
Anything still outstanding?
Just confirming night shift coverage and a couple of lab results pending. I'll include them in the notes.
Great. I've already handed over room 305's special diet to the evening nurse.
Then I'd say we're in good shape. Shall we do the final sign-off together?
Let's. Thanks for being a great teammate today.
Right back at you. Let's head out before someone calls our names again. Well, that's us nearly done. Charts are up to date, and Mrs. Murphy's set for possible discharge tomorrow.
And Aisling came full circle today. She handled that patient handoff earlier like a pro.
She really did. Big improvement in just a few hours.
Anything still outstanding?
Just confirming night shift coverage and a couple of lab results pending. I'll include them in the notes.
Great. I've already handed over room 305's special diet to the evening nurse.
Then I'd say we're in good shape. Shall we do the final sign-off together?
Let's. Thanks for being a great teammate today.
Right back at you. Let's head out before someone calls our names again.
Well done for making it to the end of Nurse Jer's day. How did you score out of 23? Post your results in the comments and challenge a friend or colleague to beat you. If you found this lesson helpful, give it a like, subscribe to the channel, and check out the full playlist for more real medical English conversations. If you want the full transcript for this lesson, join my student membership for just $4.99 a month and get instant access to all my PDF and video libraries, early releases, and lesson requests. Thanks for watching Learning English Pro. I'll see you in the next lesson. Hello and welcome back to Learning English Pro. In this lesson, we're going to cover medical conversation listening. you'll hear 5 short conversations between a nurse and a doctor. Each conversation will play twice. The second time, you will see 2 questions on screen related to the conversation you're hearing. Use these questions to test your listening skills and challenge your comprehension. There are 10 questions in total, so write your score in the comments. The full transcripts for all conversations are available through the student membership for Learning English Pro. It's just $4.99 per month. Members get access to PDF guide downloads, my video library, early access, priority requests, and additional content. This is Learning English Pro, English skills for ambitious careers. If you find this lesson helpful, like, subscribe, and hit the notification bell so you never miss a new lesson. Leave a comment with your score and let me know how you did. Let's get started.
Dr. James, sorry to disturb you. I've just been in to check on Mr. LeBlanc in room 14. He's really agitated and disoriented. I'm a bit concerned.
No problem, Priya. What's happening with him exactly?
Well, he didn't recognize me. Thought he was still in the operating theater. He kept saying he was late for his surgery and trying to get out of bed, even though he's got a catheter in. His vitals are stable, but his heart rate is slightly elevated.
That sounds like post-operative delirium. Has he had any pain relief recently?
Yes, he had 5 milligrams of morphine at around 3 a.m. He's due for another dose in about an hour, but I'm not sure if it's helping or making things worse. Last night he was relatively calm.
It could be a reaction to the morphine. Sometimes it can cause confusion, especially in older patients. Has he had a similar reaction before?
Actually, yes. His chart notes some mild confusion after his gallbladder surgery last year, but nothing this severe.
Okay, let's reassess his medication plan. I think we should hold off on the next morphine dose and switch to paracetamol IV for now. We'll see if reducing the opioids helps stabilize his mental state.
That sounds good. I'll make the note and inform the night staff. Do you think we should run any other tests?
Let's do a quick set of bloods to rule out any infection. Sometimes post-op confusion can be linked to something underlying, like a UTI or electrolyte imbalance.
I can collect the urine sample now and send it to the lab along with the bloods. Should we also check his hydration status?
Definitely. Dehydration could be a factor. Can you monitor his fluid balance over the next few hours?
Of course. I'll record his input and output, and we'll monitor his vitals closely.
Great. Let's also make sure he's in a calm environment. Lights dimmed, minimal noise. Sometimes overstimulation can worsen delirium.
I'll make sure the curtains are drawn and reduce the noise level. Should I also inform his family about his confusion?
Yes, it's a good idea. Explain that this can happen after surgery and that we're actively managing it. Reassure them that it's usually temporary.
Understood. I'll give them a call and update them. Thanks for discussing this with me. I really appreciate the support.
No problem at all. You're doing great work. Let's catch up in an hour and see how he's doing.
Will do. Thanks, Doctor. Dr. James, sorry to disturb you. I've just been in to check on Mr. LeBlanc in room 14. He's really agitated and disoriented. I'm a bit concerned.
No problem, Priya. What's happening with him exactly?
Well, he didn't recognize me. Thought he was still in the operating theater. He kept saying he was late for his surgery and trying to get out of bed, even though he's got a catheter in. His vitals are stable, but his heart rate is slightly elevated.
That sounds like post-operative delirium. Has he had any pain relief recently?
Yes, he had 5 milligrams of morphine at around 3 a.m. He's due for another dose in about an hour, but I'm not sure if it's helping or making things worse. Last night he was relatively calm.
It could be a reaction to the morphine. Sometimes it can cause confusion, especially in older patients. Has he had a similar reaction before?
Actually, yes. His chart notes some mild confusion after his gallbladder surgery last year, but nothing this severe.
Okay, let's reassess his medication plan. I think we should hold off on the next morphine dose and switch to paracetamol IV for now. We'll see if reducing the opioids helps stabilize his mental state.
That sounds good. I'll make the note and inform the night staff. Do you think we should run any other tests?
Let's do a quick set of bloods to rule out any infection. Sometimes post-op confusion can be linked to something underlying, like a UTI or electrolyte imbalance.
I can collect the urine sample now and send it to the lab along with the bloods. Should we also check his hydration status?
Definitely. Dehydration could be a factor. Can you monitor his fluid balance over the next few hours?
Of course. I'll record his input and output, and we'll monitor his vitals closely.
Great. Let's also make sure he's in a calm environment. Lights dimmed, minimal noise. Sometimes overstimulation can worsen delirium.
I'll make sure the curtains are drawn and reduce the noise level. Should I also inform his family about his confusion?
Yes, it's a good idea. Explain that this can happen after surgery and that we're actively managing it. Reassure them that it's usually temporary.
Understood. I'll give them a call and update them. Thanks for discussing this with me. I really appreciate the support.
No problem at all. You're doing great work. Let's catch up in an hour and see how he's doing.
Will do. Thanks, doctor.
Dr. Khan, I'm really sorry to bother you, but the portable ECG is acting up again. That's the third time today. I restarted it twice, but it just shows a blank screen.
You've got to be kidding. We had that machine service just last month. Which patient are we talking about?
It's Mr. Simmons in bed 5. He's reporting chest tightness and shortness of breath. I tried switching to the backup machine, but it's not charged.
All right, let's not waste any more time. We need to get him on a monitor immediately. Can we transfer him to the main ward for continuous monitoring?
I've called the porters, but they said it would take about 15 minutes. I thought about using the stationary monitor in Bay 3 instead.
Good thinking. Let's move him ourselves. We can't afford to wait that long. I'll help you transfer him.
Thanks. I've already prepared oxygen and aspirin, just in case. His vitals are stable for now, but he seems anxious.
Good call. Anxiety could be a factor here. Make sure to reassure him as we move. Once we get him settled, I'll do a quick physical exam.
Got it. I'll explain to him that we're just being cautious and that moving to Bay 3 is standard procedure.
Perfect. Let's also notify the cardiac team. If his symptoms worsen, we might need their input.
I'll do that right away. Do you think it's worth filing another maintenance request for the ECG machine?
Definitely. This is a recurring issue and it's impacting patient care. Let's document the problem and escalate it to the equipment manager.
I feel like this happens way too often. Sometimes I worry we're just patching up problems instead of solving them.
I hear you. It's frustrating, but for now, let's focus on Mr. Simmons. You've handled this well, keeping calm and proactive.
Thanks. I just hate feeling unprepared when equipment fails.
That's completely understandable. You did the right thing by acting quickly and thinking on your feet. Let's follow up with maintenance after this.
Okay, I'll start the transfer now. Thanks for being so supportive.
We're a team. Let's make sure Mr. Simmons is comfortable and reassured.
Dr. Khan, I'm really sorry to bother you, but the portable ECG is acting up again. That's the third time today. I restarted it twice, but it just shows a blank screen.
You've got to be kidding. We had that machine service just last month. Which patient are we talking about?
It's Mr. Simmons in bed 5. He's reporting chest tightness and shortness of breath. I tried switching to the backup machine, but it's not charged.
All right, let's not waste any more time. We need to get him on a monitor immediately. Can we transfer him to the main ward for continuous monitoring?
I've called the porters, but they said it would take about 15 minutes. I thought about using the stationary monitor in Bay 3 instead.
Good thinking. Let's move him ourselves. We can't afford to wait that long. I'll help you transfer him.
Thanks. I've already prepared oxygen and aspirin, just in case. His vitals are stable for now, but he seems anxious.
Good call. Anxiety could be a factor here. Make sure to reassure him as we move. Once we get him settled, I'll do a quick physical exam.
Got it. I'll explain to him that we're just being cautious and that moving to Bay 3 is standard procedure.
Perfect. Let's also notify the cardiac team. If his symptoms worsen, we might need their input.
I'll do that right away. Do you think it's worth filing another maintenance request for the ECG machine?
Definitely. This is a recurring issue and it's impacting patient care. Let's document the problem and escalate it to the equipment manager.
I feel like this happens way too often. Sometimes I worry we're just patching up problems instead of solving them.
I hear you. It's frustrating, but for now, let's focus on Mr. Simmons. You've handled this well, keeping calm and proactive.
Thanks. I just hate feeling unprepared when equipment fails.
That's completely understandable. You did the right thing by acting quickly and thinking on your feet. Let's follow up with maintenance after this.
Okay, I'll start the transfer now. Thanks for being so supportive.
We're a team. Let's make sure Mr. Simmons is comfortable and reassured.
Dr. Lee, could I have a quick word? It's about the central line placement for Mr. Turner in bed 7.
Of course, Fatima. What's on your mind?
I didn't want to say anything in front of the intern earlier, but I noticed that he broke the sterile field. His glove brushed the monitor cable while adjusting the line, and he didn't change gloves. I wasn't sure how to address it at the time.
Thanks for telling me. That's definitely a concern. Was the patient exposed to any open wounds during the procedure?
Not directly. The insertion site was still covered, but I'm worried about contamination. I was debating whether to speak up during the procedure, but I didn't want to undermine him.
It's a tricky situation, and I appreciate your discretion. In those cases, it's always better to prioritize patient safety, even if it feels uncomfortable. I would have backed you up if you had mentioned it.
Next time, I'll say something immediately. I just didn't want to disrupt his focus.
That's understandable. If it helps, we can arrange a quick debrief with him so he knows for next time. I'll make sure it's supportive, not critical.
That would be really helpful. I also wondered if we should do anything preventative for Mr. Turner since there's a potential contamination risk.
Good thinking. Let's start with close monitoring of the site for any signs of infection, redness, swelling, or discharge. We can also mark it in the notes so that everyone is aware.
Should we consider starting prophylactic antibiotics just to be safe?
Since the risk is relatively low, I'd prefer to hold off and monitor first. If anything develops, we can reassess. What's your gut feeling on his overall condition?
He's stable, but a bit anxious after the procedure. I reassured him that everything went smoothly, but I'll keep an eye on his vitals.
Sounds good. I'll follow up with the intern. We'll approach it as a learning point, and I'll make sure he knows you acted in the patient's best interest.
Thank you for handling it so professionally. I really value that.
And I value your judgment. You did the right thing by raising this. Let's make sure Mr. Turner remains stable.
Dr. Lee, could I have a quick word? It's about the central line placement for Mr. Turner in bed 7.
Of course, Fatima. What's on your mind?
I didn't want to say anything in front of the intern earlier, but I noticed that he broke the sterile field. His glove brushed the monitor cable while adjusting the line, and he didn't change gloves. I wasn't sure how to address it at the time.
Thanks for telling me. That's definitely a concern. Was the patient exposed to any open wounds during the procedure?
Not directly. The insertion site was still covered, but I'm worried about contamination. I was debating whether to speak up during the procedure, but I didn't want to undermine him.
It's a tricky situation, and I appreciate your discretion. In those cases, it's always better to prioritize patient safety, even if it feels uncomfortable. I would have backed you up if you had mentioned it.
Next time, I'll say something immediately. I just didn't want to disrupt his focus.
That's understandable. If it helps, we can arrange a quick debrief with him so he knows for next time. I'll make sure it's supportive, not critical.
That would be really helpful. I also wondered if we should do anything preventative for Mr. Turner since there's a potential contamination risk.
Good thinking. Let's start with close monitoring of the site for any signs of infection, redness, swelling, or discharge. We can also mark it in the notes so that everyone is aware.
Should we consider starting prophylactic antibiotics just to be safe?
Since the risk is relatively low, I'd prefer to hold off and monitor first. If anything develops, we can reassess. What's your gut feeling on his overall condition?
He's stable, but a bit anxious after the procedure. I reassured him that everything went smoothly, but I'll keep an eye on his vitals.
Sounds good. I'll follow up with the intern. We'll approach it as a learning point, and I'll make sure he knows you acted in the patient's best interest.
Thank you for handling it so professionally. I really value that.
And I value your judgment. You did the right thing by raising this. Let's make sure Mr. Turner remains stable.
Dr. Kamal, can I talk to you for a moment? It's about Mrs. O'Neill's daughter.
Of course. What's going on?
She's really struggling. Even though we discussed the palliative care plan yesterday, she keeps insisting that we do more. She's asking for more tests and a second opinion.
That's understandable. Sometimes acceptance takes time. Did she say what specifically she's worried about?
She kept repeating, "You're giving up on her." I tried to explain that we're focused on comfort now, but it didn't seem to reassure her.
That's tough. Sometimes families feel helpless when there's no active treatment. Did you ask her what she thinks doing more would look like?
Yes. She mentioned trying a different medication. She even asked if we could transfer her mother to another hospital. I didn't want to outright say it wasn't possible.
You did the right thing by listening. I can call her and go over the plan again. Sometimes hearing it from both of us can help.
That might work. I just worry about how much we can really say without making promises.
It's a fine line. We can acknowledge her feelings without giving false hope. I'll explain that the team is constantly reassessing to ensure her mother's comfort.
Should we involve palliative care again to help address her concerns?
Yes, let's get them on board. They're skilled at guiding families through this. Also, let's document the family's concerns so it's clear that we're being thorough.
Good idea. I'll make a note in the file after we speak to her. Do you think we should set up a follow-up meeting with the family?
Absolutely. Maybe a family conference where we can discuss the plan in a supportive environment. That way, they know we're still actively involved in her care.
I can arrange that. I'll also spend some time with Mrs. O'Neill to make sure she's comfortable and talk to her a bit.
Great. Let's keep reassuring both the patient and the family. You're handling this really well.
Thanks, Doctor. I just want to make sure I'm doing right by the family while keeping realistic expectations.
You are. Balancing empathy and honesty is never easy, but you're doing it with compassion.
Dr. Kamal, can I talk to you for a moment? It's about Mrs. O'Neill's daughter.
Of course. What's going on?
She's really struggling. Even though we discussed the palliative care plan yesterday, she keeps insisting that we do more. She's asking for more tests and a second opinion.
That's understandable. Sometimes acceptance takes time. Did she say what specifically she's worried about?
She kept repeating, "You're giving up on her." I tried to explain that we're focused on comfort now, but it didn't seem to reassure her.
That's tough. Sometimes families feel helpless when there's no active treatment. Did you ask her what she thinks doing more would look like?
Yes. She mentioned trying a different medication. She even asked if we could transfer her mother to another hospital. I didn't want to outright say it wasn't possible.
You did the right thing by listening. I can call her and go over the plan again. Sometimes hearing it from both of us can help.
That might work. I just worry about how much we can really say without making promises.
It's a fine line. We can acknowledge her feelings without giving false hope. I'll explain that the team is constantly reassessing to ensure her mother's comfort.
Should we involve palliative care again to help address her concerns?
Yes, let's get them on board. They're skilled at guiding families through this. Also, let's document the family's concerns so it's clear that we're being thorough.
Good idea. I'll make a note in the file after we speak to her. Do you think we should set up a follow-up meeting with the family?
Absolutely. Maybe a family conference where we can discuss the plan in a supportive environment. That way, they know we're still actively involved in her care.
I can arrange that. I'll also spend some time with Mrs. O'Neill to make sure she's comfortable and talk to her a bit.
Great. Let's keep reassuring both the patient and the family. You're handling this really well.
Thanks, Doctor. I just want to make sure I'm doing right by the family while keeping realistic expectations.
You are. Balancing empathy and honesty is never easy, but you're doing it with compassion.
Dr. Alvarez, can I just grab you for a second? It's about Mr. Chow's discharge meds.
Of course, Jasmine. What's the issue?
His chart says he's on 20 milligrams of lisinopril, but the discharge form only lists 10 milligrams. I didn't want to send him home with the wrong dose, so I held off processing it.
Good catch. Let me double-check his medical record. Sometimes the electronic system pulls outdated information.
That's what I thought too. The form looks like it's from his last admission, not the current one.
You're right. The system pulled up his previous discharge plan. It should be 20 milligrams as per his latest treatment adjustment. Thanks for spotting that.
No problem. Do you want me to call pharmacy and have it corrected?
Yes, please. Make sure they update it on his electronic file, too. We don't want this to repeat next time he's admitted.
Will do. Do you think it's worth noting in his chart that the error was caught before discharge?
Absolutely. Documenting that is essential. It shows due diligence and highlights that the error was identified before any risk to the patient.
I'm glad I caught it. I nearly missed it because the previous dose was on top.
It happens. The important thing is you trusted your instincts and double-checked. I really appreciate that.
Thanks. I just don't like the idea of a patient going home with the wrong dose, especially with lisinopril. It could have caused some serious issues.
Exactly. Blood pressure management is crucial. I'll make a note for the pharmacy manager to review the electronic template. It shouldn't be pulling outdated data like that.
That would help. It's not the first time I've seen this happen. Maybe they could add a prompt to double-check previous admissions.
Great idea. Let's suggest that in the next team meeting. Meanwhile, let's get Mr. Chow sorted so he can go home safely.
I'll update the file and give pharmacy a quick call. I'll also explain to Mr. Chow that we've double-checked his meds.
Good plan. Make sure he knows it's all sorted before he leaves. You've done great work on this.
Thanks. I just want to make sure everything's right. I'll follow up on the pharmacy update, too.
Perfect. Let me know if you need any more support.
Dr. Alvarez, can I just grab you for a second? It's about Mr. Chow's discharge meds.
Of course, Jasmine. What's the issue?
His chart says he's on 20 milligrams of lisinopril, but the discharge form only lists 10 milligrams. I didn't want to send him home with the wrong dose, so I held off processing it.
Good catch. Let me double-check his medical record. Sometimes the electronic system pulls outdated information.
That's what I thought, too. The form looks like it's from his last admission, not the current one.
You're right. The system pulled up his previous discharge plan. It should be 20 milligrams as per his latest treatment adjustment. Thanks for spotting that.
No problem. Do you want me to call pharmacy and have it corrected?
Yes, please. Make sure they update it on his electronic file, too. We don't want this to repeat next time he's admitted.
Will do. Do you think it's worth noting in his chart that the error was caught before discharge?
Absolutely. Documenting that is essential. It shows due diligence and highlights that the error was identified before any risk to the patient.
I'm glad I caught it. I nearly missed it because the previous dose was on top.
It happens. The important thing is you trusted your instincts and double-checked. I really appreciate that.
Thanks. I just don't like the idea of a patient going home with the wrong dose, especially with lisinopril. It could have caused some serious issues.
Exactly. Blood pressure management is crucial. I'll make a note for the pharmacy manager to review the electronic template. It shouldn't be pulling outdated data like that.
That would help. It's not the first time I've seen this happen. Maybe they could add a prompt to double-check previous admissions.
Great idea. Let's suggest that in the next team meeting. Meanwhile, let's get Mr. Chow sorted so he can go home safely.
I'll update the file and give pharmacy a quick call. I'll also explain to Mr. Chow that we've double-checked his meds.
Good plan. Make sure he knows it's all sorted before he leaves. You've done great work on this.
Thanks. I just want to make sure everything's right. I'll follow up on the pharmacy update, too.
Perfect. Let me know if you need any more support.
Great job completing this medical conversation listening English lesson. Remember, practicing listening skills like this can make a huge difference in your professional communication. Don't forget to share your score in the comments below. I'd love to hear from you and how you got on. Have you ever struggled to find the right way to describe an injury in English? Maybe you know the everyday term, but not the precise medical name, or vice versa. Or perhaps you're preparing for the OET exam and want to sound more confident when discussing patient injuries. Well, in this lesson, I've got you covered. Hi, my name is Jer, and this is Learning English Pro, the channel that helps healthcare professionals like you excel in English and advance in your careers. Today's lesson is perfect for physiotherapists, nurses, doctors, and anyone studying for the OET. We're covering 50 essential injuries and physical conditions, from sprains and fractures to dislocations and ruptures, all explained in clear professional English. Student members can access a handy guide for this lesson in the Membership tab. It includes everything from today's video, plus exercises like my AI-generated homework to help you practice and remember what you learn. Here's how the lesson will work. I'll give you the most commonly used term for the injury, then we'll go over the proper medical name. Next, I'll explain the condition with a clear, concise definition. You'll also see visuals to help you fully understand the term. Finally, we'll look at an example sentence using natural collocations, so you'll learn the right way to talk about these injuries in a real-life medical setting. This lesson packs in a lot of information, so choose how you want to learn. Active learners, watch the full lesson in a quiet, focused space, take notes with a pen and paper, and think about which terms you're most likely to use in your work. And let me know in the comments which injuries you encounter the most. For passive learners, play this video in the background while you go about your day. This is a great way to absorb English naturally without needing to sit down and study. Alright then, let's get started. Our first condition is a broken bone. The medical term for this is a fracture. Let's take a look at our first definition. A broken bone or a fracture is a break in a bone, which may be minor, like a hairline fracture, or severe, like a compound fracture. And let's take a look at our example sentence. The X-ray confirmed that he has a fractured wrist, and he'll need a cast. Let's move on to dislocated shoulder. And the medical term is quite similar, shoulder dislocation. Our definition is when the upper arm bone or the humerus comes out of its socket. Our example sentence, he fell off his bike and dislocated his shoulder, requiring immediate treatment. Third on our list is a sprained ankle, also referred to as an ankle sprain. This is defined as a stretched or torn ligament in the ankle. She twisted her foot while running and now has a sprained ankle. Let's move on to pulled muscle. This can also be referred to as muscle strain or strained muscle. It is an overstretching or tearing of muscle fibers. Let's take a look at our example sentence. He lifted a heavy box and ended up with a strained back muscle. Our fifth term is bruise. The medical term for this is contusion. The definition is a bleeding under the skin due to a blunt injury. After falling on the stairs, she developed a large bruise on her thigh. Our next condition is a swollen knee. In medical terminology, this is known as a knee effusion. It is a fluid buildup in or around the knee joint due to injury or inflammation. His knee is swollen after the accident, and the doctor suspects ligament damage. Let's move on to a torn ligament. You can tear a ligament in lots of different places. One common type is known as an ACL tear. It is a tear in the ACL, which of course is a ligament in the knee. Our example sentence is, the footballer was sidelined for months after an ACL tear. Let's move on to torn cartilage. There is cartilage in different parts of the body. One common type of torn cartilage is a meniscus tear. This is damage to the cartilage in the knee, often caused by twisting. He needed surgery to repair a torn meniscus. Our ninth term is a cracked rib. In medical terminology, it would be known as a rib fracture. This is a break or crack in one of the ribs, usually caused by trauma. She has a cracked rib from the car accident, but it will heal on its own. Let's move on to frozen shoulder, also known in medical terms as adhesive capsulitis. This is a stiffness and pain in the shoulder joint, leading to limited movement. Let's take a look at our example. He developed frozen shoulder after months of inactivity. Our next condition is sports-related, a tennis elbow, also known as lateral epicondylitis. It is an inflammation of the tendons in the elbow due to overuse. His doctor diagnosed him with tennis elbow from repetitive lifting. A similar condition is golfer's elbow. This is known as medial epicondylitis, and it is an inflammation of the tendons on the inside of the elbow. Let's take a look at our example sentence. The patient complained of pain due to golfer's elbow. We are already on our 13th term, which is a slipped disc. In medical terms, this would be known as a herniated disc, and it describes a spinal disc that is moved out of place, pressing on nerves. He has a herniated disc causing severe back pain. Next up, we have whiplash. This is also known as cervical strain. It describes a neck injury caused by sudden back and forth motion, often from car accidents. After the car crash, she suffered from whiplash. Let's move on to concussion. In medical terms, this could be called a mild traumatic brain injury, or an MTBI. This is a temporary loss of brain function due to a head injury. Let's take a look at our example. The boxer was taken to the hospital with a concussion. A common injury is a black eye. also known in medical terms as a periorbital hematoma. This is a bruising around the eye due to impact. He got a black eye after being hit in the face. Our 17th condition is a burst appendix. In medical terms, it might be called a ruptured appendix. This is a life-threatening condition where the appendix bursts, leading to infection. She was rushed to surgery for a ruptured appendix. Let's move on to collapsed lung, medically known as pneumothorax. This is where air leaks into the chest cavity, causing the lung to collapse. A severe injury caused a collapsed lung, requiring immediate treatment. Next, we have a gunshot wound. In medical terms, it might be called a ballistic trauma. And of course, this is an injury or a wound caused by a bullet or firearm. The patient arrived with a gunshot wound to the shoulder. A deep cut is another condition, also known in medical terms as a laceration. This is a deep tear or cut in the skin. The kitchen knife accident left him with a deep laceration on his hand. Let's move on to a burn, or in medical terms, a thermal burn. This is damage to the skin caused by heat, fire, or chemicals. The chef suffered a second-degree burn from boiling water. A similar condition is sunburn. This is also known as radiation burn, and this is skin damage caused by excessive UV exposure. After a day at the beach without sunscreen, she got severe sunburn. Our next condition is the opposite of sunburn, frostbite. And frostbite is what it would be known as in medical terms. This is tissue damage caused by extreme cold, leading to numbness and discoloration. Let's take a look at our example. The hiker developed frostbite on his fingers after being stuck in the snow. Let's move on to a nosebleed, in medical terms, epistaxis. This is bleeding from the nose due to injury or dry air. He had a nosebleed after getting hit in the face during the game. Next up, we have knocked out tooth, known medically as an avulsed tooth, and this is where a tooth has become completely dislodged from its socket. The boxer had a knocked out tooth and needed immediate dental care. Another common dental condition is a chipped tooth, known medically as a dental fracture. This describes a small break or crack in a tooth. She bit into a hard candy and ended up with a chipped tooth. Condition number 27 is a split lip. In medical terms, it's known as a lip laceration, and this describes a deep cut or tear in the lip. He fell off his bike and ended up with a split lip. Next up, we have stab wound. This can be known medically as a penetrating trauma and describes a deep wound caused by a sharp object. Our example is, the paramedics treated a patient with a stab wound to the abdomen. Let's move on to punctured lung. This can also be called a traumatic pneumothorax. It describes a lung injury where air leaks into the chest cavity. The patient had a punctured lung due to a fractured rib. We are already at number 30, internal bleeding. In medical terms, this would be called a hemorrhage, and it defines bleeding inside the body, often due to trauma. Let's take a look at our example. The car crash victim showed signs of internal bleeding and needed surgery. Next up, we have a swollen lip. In medical terms, this would be called a lip edema. It describes a swelling of the lips due to something like an injury or an allergy. After the allergic reaction, his lip was swollen and painful. Next, we have sprained wrist, or a wrist sprain. This is a stretched or torn ligament in the wrist. She slipped on ice and ended up with a sprained wrist. A jammed finger can also be called a finger sprain. This is an injury to the ligaments in the finger due to impact. He jammed his finger playing basketball and now it's swollen and stiff. Let's move on to the nicely named turf toe. Better known in medical circles as metatarsal phalangeal joint sprain. This describes a sprain of the big toe. It's common in athletes. And our example sentences: the footballer was sidelined with turf toe after a rough tackle. Our next condition is one I have suffered with myself: shin splints. Medically, it is known as medial tibial stress syndrome. It describes a pain along the shin bone due to overuse. The new runner develops shin splints from training too hard. An Achilles tendon tear is also known as an Achilles tendon rupture. It describes a complete tear of the Achilles tendon, which connects the calf to the heel. He collapsed in pain after an Achilles tendon rupture during a sprint. Number 37 is a rotator cuff tear, also known as a rotator cuff injury. It describes a tear in the muscles or tendons of the shoulder. The swimmer was diagnosed with a rotator cuff tear and needed physical therapy. Let's move on to a boxer's fracture. In medical terms, a fifth metacarpal fracture. This is a fracture of the hand bones, often caused by punching a hard object. He broke his hand in a fight and was diagnosed with a boxer's fracture. Next up, we have groin strain, also known as adductor muscle strain. This describes an overstretching or tearing of the muscles in the groin area. Let's take a look at our example. He had to stop playing due to a groin strain. Let's move on to blister. This can also be known as a friction blister. It is a fluid-filled bubble on the skin caused by friction or burns. She developed blisters on her feet from wearing new shoes. The term bed sores can also be referred to as pressure ulcers. These are skin wounds caused by prolonged pressure, common in immobile patients. The nurse treated the elderly patient's bed sores with special dressings. Next, we have ear barotrauma. In medical terms, this would be known as barotitis media. It describes damage to the ear due to sudden pressure changes. He experienced ear barotrauma while scuba diving. Our next term is dehydration. In medical terms, it can also be known as hypohydration. And of course, this is a condition where the body loses too much fluid. The marathon runner suffered from severe dehydration. Our next type of injury is an electric shock. You might hear this referred to as an electrical burn or electrocution, and it's defined as an injury caused by contact with electricity. Let's take a look at our example. The worker was rushed to the hospital after an electric shock. Condition number 45 is a broken nose, also known as a nasal fracture. This is a break or crack in the bones of the nose, often caused by impact. The rugby player suffered a broken nose after a head collision. Let's move on to a hip fracture. In medical terms, a femoral neck fracture, and this describes a break in the upper part of the thigh bone. The elderly woman needed surgery after a hip fracture. Compartment syndrome, or acute compartment syndrome, describes pressure in a muscle area, cutting off circulation. Let's take a look at our example. The patient needed emergency surgery for compartment syndrome. Our next injury is an eye scratch. In medical terms, this could be known as a corneal abrasion. It describes a scratch on the eye's surface, causing pain and redness. The doctor prescribed eye drops for his corneal abrasion. Number 49 is a blood clot. There are lots of different types of blood clot. Today we'll cover deep vein thrombosis, or DVT. DVT is a clot in a deep vein, usually in the legs. He was diagnosed with deep vein thrombosis after a long flight. Our final condition is seizure injury, known as a postictal injury in medical terms. This is a trauma caused by uncontrolled body movements during a seizure. Let's take a look at our final example. He bit his tongue due to a seizure injury and required medical care. Well done, you've made it to the end of this lesson, and that's a huge achievement. Learning medical English takes time and practice, and you're doing great. To get the most out of this lesson, I recommend repeating the lesson. Repetition is key to remembering new vocabulary. Practice the terms by saying them out loud or writing them in sentences. Share this lesson with a colleague or friend and have a chat about it. This is a great way for both of you to improve your English around this subject. Hello and welcome to Learning English Pro. I'm Jer, your online English teacher and guide. Today we're diving into 100 common medications, learning about different types of medications, their uses, symptoms they treat, and correct pronunciation. This lesson will help you sound confident and professional when discussing these medications in English. To make your learning even more comprehensive, I've created a PDF guide for this lesson, which includes all the content we'll cover. This guide is available exclusively to student members of my channel. It's a fantastic way to take your learning further and get even more value from each lesson. If you're interested in these extra tools and support, consider joining the student membership for the price of a cup of coffee. It's a great way to support the channel, deepen your English language skills, and stay connected with all the new content on the channel. Now let's get started with our lesson on 100 common medications. We will go through 20 different types of medication, starting with an explanation, followed by a list of example medications, and then some example English sentences. If you are looking for healthcare advice on medications or symptoms, then ask a healthcare professional like a doctor or a nurse. So if you're ready, let's get started. Our first medication type is anesthesia. Now on screen you can see here that we have two different spellings, one for American English and the other for British English. Anesthesia is used to induce a loss of sensation or consciousness, often for surgical procedures. These medications may be general, affecting the entire body, or local, targeting a specific area. Anesthetics are essential in pain-free medical interventions. Different types of anesthesia include propofol. This is used for general anesthesia and is commonly known as the Michael Jackson drug. Lidocaine. This is a local anesthetic, often used in dental procedures. Isoflurane is a gas anesthetic commonly used during surgeries. Ketamine is a powerful anesthetic also used in emergency pain management. Bupivacaine is a long-acting local anesthetic used in epidurals. Let's take two of these words and use them in example sentences. The surgeon administered propofol to induce general anesthesia before the procedure. For minor dental work, the dentist used lidocaine to numb the area. Our next category of medicine is painkillers, also called analgesics. These medications are ones that relieve pain. They range from mild over-the-counter options to stronger prescription drugs. Painkillers are classified into non-opioid, opioid, and NSAIDs. Different types of painkillers include aspirin, a common over-the-counter pain reliever and anti-inflammatory. Ibuprofen. This treats mild to moderate pain. Morphine. This is a powerful opioid painkiller for severe pain. Acetaminophen, also known as Tylenol, is used for mild pain and fever. Codeine is an opioid used for pain relief and sometimes in cough syrups. After the surgery, the doctor prescribed morphine to manage the patient's pain. Ibuprofen is often recommended for reducing inflammation and mild pain. Our next medicine category is antibiotics. Antibiotics are medications that kill or inhibit the growth of bacteria, used to treat bacterial infections. They are not effective against viruses and should be only used as prescribed to prevent antibiotic resistance. Amoxicillin is a widely used antibiotic for bacterial infections. Azithromycin treats respiratory and skin infections. Ciprofloxacin is an antibiotic often prescribed for urinary tract infections. Doxycycline is used to treat various infections, including acne. Penicillin, one of the oldest antibiotics, is still used for specific bacterial infections. Let's take a look at our example sentences. The patient was prescribed amoxicillin for a bacterial throat infection. For skin infections, doxycycline is a common and effective choice. Let's move on to antidepressants. These are medications used to treat depression, anxiety, and certain other mood disorders. They work by balancing chemicals in the brain to improve mood, sleep, and energy levels. Our first antidepressant is fluoxetine. This is commonly known as Prozac. It treats depression and anxiety. Sertraline, known as Zoloft, is used for depression, anxiety, and PTSD. Amitriptyline is an older antidepressant, which is also used for chronic pain. Escitalopram, also known as Lexapro, is used for depression and generalized anxiety disorder. Venlafaxine treats major depressive and anxiety disorders. Fluoxetine is often prescribed for patients experiencing chronic depression. Sertraline is commonly used to manage both depression and anxiety. Our next medication classification is antipsychotics. This type of medication is used to manage psychosis, including schizophrenia and bipolar disorder. They help reduce hallucinations, delusions, and other severe mental health symptoms. Risperidone is used to treat schizophrenia and bipolar disorder. Olanzapine is prescribed for bipolar disorder and schizophrenia. Clozapine is used for treatment-resistant schizophrenia. Quetiapine treats both bipolar disorder and depression. And we have aripiprazole, which is also used for schizophrenia and bipolar disorder. The patient was given risperidone to help manage symptoms of schizophrenia. Olanzapine is effective for treating mood swings in bipolar disorder. Next up, we have antihistamines. Antihistamines relieve allergy symptoms by blocking histamine, a substance in the body that causes allergic reactions. They are used for conditions like hay fever, itching, and some respiratory allergies. Loratadine, also known as Claritin, is commonly used for seasonal allergies. Diphenhydramine, also known as Benadryl, relieves allergies and cold symptoms. Cetirizine treats hay fever and skin allergies. Fexofenadine is used for seasonal allergy symptoms. Hydroxyzine is used for itching and anxiety, often in short-term settings. Loratadine is effective for relieving symptoms of seasonal allergies. For severe itching, hydroxyzine may be prescribed as an antihistamine. Our next medication category is diuretics, also known as water pills. This type of medication helps the body eliminate excess fluid by increasing urine production. They're commonly prescribed for conditions like hypertension, heart failure, and kidney issues. Our first diuretic is furosemide. This drug is commonly used for heart failure. Hydrochlorothiazide treats high blood pressure and fluid retention. Spironolactone is a potassium-sparing diuretic used for fluid retention. Bumetanide is used to reduce swelling due to fluid buildup. Chlorthalidone is a diuretic often prescribed for hypertension. Let's check out our example sentences. The doctor prescribed furosemide to manage the patient's heart failure symptoms. Hydrochlorothiazide is commonly used to treat high blood pressure. Our next medication category is anticoagulants. These are often referred to as blood thinners. Anticoagulants prevent blood clots, reducing the risk of stroke, heart attack, and other cardiovascular issues. They are vital for patients at high risk of blood clots. Our first type is warfarin. Warfarin is a commonly used blood thinner. Next up, we have heparin, which is often used in hospitals for blood clot prevention. Dabigatran is an oral anticoagulant. Apixaban is used to reduce stroke risk. Rivaroxaban is a blood thinner for clot prevention. Warfarin is often prescribed to patients with an elevated risk of stroke. Apixaban is taken daily to prevent blood clots in high-risk individuals. Let's move on to anti-inflammatory drugs, otherwise known as NSAIDs. This type of medication is used to reduce inflammation, pain, and fever. They're commonly available over the counter and treat various conditions, from arthritis to headaches. Our first type of anti-inflammatory is ibuprofen. This is commonly known in the United States as Advil, a common NSAID. Naproxen is used for pain and inflammation. Celecoxib is often used for arthritis. Indomethacin is used to reduce inflammation in arthritis. Diclofenac is often prescribed for severe pain and inflammation. Ibuprofen is often used to reduce inflammation and treat mild pain. For joint pain, naproxen can be effective in reducing inflammation. Let's move on to antacids and acid reducers. This type of medication is used to relieve symptoms of acid reflux, heartburn, and indigestion. Antacid neutralize stomach acid, while acid reducers lower acid production in the stomach. Omeprazole is used for acid reflux and GERD. Ranitidine is commonly used for heartburn, but it is now discontinued in many markets across the world. Calcium carbonate, also known as the brand Tums, is an over-the-counter antacid. Famotidine is used to reduce stomach acid. Esomeprazole is used for acid reflux. Omeprazole is often prescribed for patients with chronic acid reflux. For quick relief, calcium carbonate can neutralize stomach acid on the spot. Let's move on to bronchodilators, or respiratory medications. This type of drug is one that helps open the airways in the lungs, making breathing easier. They are commonly prescribed for asthma, COPD, and other respiratory conditions. Albuterol is commonly used for asthma attacks. Ipratropium is used for COPD. Salmeterol is a long-acting bronchodilator. Theophylline is used for asthma and other lung diseases. Tiotropium is used for long-term COPD management. Let's check out our example sentences. During an asthma attack, albuterol provides quick relief by opening the airways. Salmeterol is often prescribed for patients needing long-term asthma control. Our next medicine category is antivirals. Antivirals are medications that treat viral infections by inhibiting the development of the virus. They are used for conditions like flu, herpes, and HIV. Our first antiviral is acyclovir. This is known as Civirix, and it's used for herpes infections. Oseltamivir, also known as Tamiflu, is used for influenza. Valacyclovir is used for herpes and shingles. Tenofovir is used for hepatitis B and HIV. Remdesivir is used for COVID-19 in specific settings. Acyclovir is prescribed to help manage herpes symptoms. For flu symptoms, oseltamivir is often recommended during flu season. Our 13th category of medication is anti-diabetics. Anti-diabetic medications help manage blood sugar levels in people with diabetes. These include insulin and various oral medications. Metformin is a commonly prescribed medication for type 2 diabetes. Insulin is a hormone used to control blood sugar, often injected. Glipizide stimulates insulin production. Sitagliptin helps control blood sugar. Next up, we have pioglitazone. This medication helps regulate glucose. Let's take a look at our example sentences. Patients with type 2 diabetes are often started on metformin to control blood sugar. Insulin injections are necessary for many patients with type 1 diabetes. Next up, we have corticosteroids, or commonly just referred to as steroids. These medications are used to treat a wide range of conditions, including asthma, allergies, and arthritis. They work by reducing inflammation and immune response. Prednisone is used for inflammation and autoimmune conditions. Hydrocortisone is available as a cream for rashes and inflammation. Dexamethasone is a powerful steroid used in severe inflammation cases. Methylprednisolone is used for severe allergies. And betamethasone is often used as a topical cream for skin conditions. Prednisone is commonly prescribed for patients with severe allergies. For joint inflammation, methylprednisolone can provide relief. Our next category of medication is laxatives and stool softeners. This type of medication helps relieve constipation by promoting bowel movements or softening stool, making it easier to pass. Psyllium, also known as Metamucil, is a fiber-based laxative. Next up, we have Docusate, which is a stool softener. Polyethylene glycol is used for constipation. There is also Senna, a herbal laxative available over the counter. Bisacodyl, also known as Ducalex, stimulates bowel movements. Let's check out our example sentences. First up, polyethylene glycol is recommended for chronic constipation. Docusate is a gentle option for softening stool without causing cramps. Our 16th category of medications is antihypertensives, also known as blood pressure medications. Antihypertensives are used to control high blood pressure, reducing the risk of heart attack, strokes, and kidney disease. Lisinopril is an ACE inhibitor used to lower blood pressure. Amlodipine is a calcium channel blocker. Losartan is an angiotensin II receptor blocker, or A or B. Metoprolol is a beta blocker also used for heart rate control. Hydrochlorothiazide is a diuretic also used to lower blood pressure. The doctor prescribed lisinopril to manage the patient's high blood pressure. Amlodipine helps relax blood vessels, making it easier for blood to flow. Our next type of medication is muscle relaxants. Muscle relaxants relieve muscle spasms and tightness, often prescribed for back pain, muscle injuries, and other painful conditions. First up, we have cyclobenzaprine. This is a common muscle relaxant. Methylcarbamol is used for muscle pain. Baclofen is used for muscle spasticity in neurological conditions. Up next, we have tizanidine, which treats muscle tightness. Diazepam, also known as Valium, is used as a muscle relaxant and anti-anxiety medication. Cyclobenzaprine is commonly used for relief from muscle spasms. For chronic muscle tightness, tizanidine may be prescribed. Our 18th category of medication is anti-seizure medications or anticonvulsants. This type of medication prevents or reduces the frequency of seizures. They are essential in the treatment of epilepsy and may be used for mood stabilization or neuropathic pain. Phenytoin is commonly used for epilepsy. Carbamazepine treats seizures and nerve pain. Valproate treats seizures, and is also used for bipolar disorder. Up next, we have levetiracetam. This is a newer anti-seizure drug. Gabapentin is used for nerve pain and seizures. Let's check out our example sentences. Phenytoin is prescribed to control seizure activity in epilepsy. For neuropathic pain, gabapentin is commonly used as an off-label treatment. Our penultimate category is for antiemetics, also known as nausea relief. These types of medications are used to prevent or relieve nausea and vomiting, commonly prescribed for patients undergoing chemotherapy, surgery, or those with severe motion sickness. Ondansetron is a medication widely used to prevent nausea. Metoclopramide treats nausea and aids digestion. Prochlorperazine is used for severe nausea. Promethazine treats nausea and motion sickness. Scopolamine is a patch or tablet often used for motion sickness. Patients receiving chemotherapy are often prescribed ondansetron to manage nausea. Promethazine is a go-to medication for preventing motion sickness on long journeys. Our final category of medication is immunosuppressants. Immunosuppressants are medications that suppress the immune system, commonly used for patients with autoimmune diseases or those who have undergone organ transplants to prevent rejection. Cyclosporine is often used to prevent organ transplant rejection. Methotrexate is used for autoimmune conditions like rheumatoid arthritis. Azathioprine is used for lupus and Crohn's disease. Tacrolimus is often used for kidney and liver transplant patients. Mycophenolate is an immunosuppressant used after organ transplants. Cyclosporine is essential for patients who have undergone organ transplants. For managing autoimmune conditions, methotrexate can be an effective treatment. And there we have it. Thank you for joining me for this lesson on 100 common medications in English. I hope you found it useful in building your confidence with medical English. Remember, the key to mastering this vocabulary is practice and repetition, so feel free to revisit this lesson as often as you need. For those Hello and welcome to Learning English Pro. I'm Jer, your CELTA-trained English teacher. In today's lesson, we're going to cover 100 essential phrases for veterinary practice for upper, intermediate and advanced English learners working with animals. By the end of this video, you'll be able to communicate more confidently in a veterinary clinic or hospital. The lesson is packed with useful real-world phrases, so be sure to stick around and practice out loud with me. And on a quick note, I have a student membership for just $4.99 on my channel that gives you access to downloadable lesson guides for all my new videos. If you prefer a one-time purchase, you can also get the PDF guide for this lesson from my YouTube store for $4.99. The PDF includes all 100 phrases, language notes, practice exercises, and a really great glossary. Check out the links in the video description below. So, how does this lesson work? I've divided the 100 phrases into 10 key topics for a vet's practice. For each topic, I'll say 10 phrases that you can use in that scenario. I'll say each phrase twice. Listen the first time, then repeat the phrase out loud the second time. Speaking along with me will help you remember the phrases and improve your pronunciation. Ready? Let's get started. Our first topic is clinical examinations. These phrases will help you during a routine checkup or physical exam on an animal. I'm going to check his eyes and ears. I'm going to check his eyes and ears. I'm going to listen to his heart and lungs. I'm going to listen to his heart and lungs. His heart sounds normal. His heart sounds normal. Does it hurt when I press here? Does it hurt when I press here? I'm going to feel his abdomen. I'm going to feel his abdomen. He has a slight fever. He has a slight fever. She weighs 10 kilos, about 22 pounds. She weighs 10 kilos, about 22 pounds. Her coat looks healthy and shiny. Her coat looks healthy and shiny. Could you hold him still for me, please? Could you hold him still for me, please? Everything looks good. Everything looks good. Great job. If you found these examination phrases useful, hit the like button below. Now that we've covered clinical examinations, let's move on to our next topic, client communication. These phrases will help you communicate effectively with pet owners or clients. What brings you and your pet in today? What brings you and your pet in today? How long has he been experiencing these symptoms? How long has he been experiencing these symptoms? Is he on any medications currently? Is he on any medications currently? I know it's hard to see him in pain. I know it's hard to see him in pain. We'll do our best to take care of him. We'll do our best to take care of him. Let's discuss the treatment options. Let's discuss the treatment options. Based on his symptoms, I recommend a blood test. Based on his symptoms, I recommend a blood test. Do you have any questions for me? Do you have any questions for me? I'll send you home with instructions. I'll send you home with instructions. If you notice any changes, please call us. If you notice any changes, please call us. Excellent. Make sure you're subscribed to the channel so you don't miss future lessons. Next, we'll look at phrases for surgery prep, preparing for surgical procedures. Please don't feed him after midnight before the surgery. Please don't feed him after midnight before the surgery. We'll run blood tests before the surgery. We'll run blood tests before the surgery. Please sign the consent form for the surgery. Please sign the consent form for the surgery. She will be under general anesthesia during the procedure. She will be under general anesthesia during the procedure. We'll place an IV catheter for fluids. We'll place an IV catheter for fluids. We need to shave the area around the incision site. We need to shave the area around the incision site. Her surgery is scheduled for tomorrow morning. Her surgery is scheduled for tomorrow morning. We'll monitor her vital signs throughout the surgery. We'll monitor her vital signs throughout the surgery. After the surgery, she'll be in recovery for a few hours. After the surgery, she'll be in recovery for a few hours. We'll call you as soon as she's awake. We'll call you as soon as she's awake. Remember, you can download all these phrases in the handy PDF guide. Check the description for the links. Now let's move on to the medication and prescription section, where you'll learn how to talk about medicines and instructions for pet care. Give this medication twice a day with food. Give this medication twice a day with food. Make sure to finish the entire course of antibiotics. Make sure to finish the entire course of antibiotics. I'll prescribe a painkiller for him. I'll prescribe a painkiller for him. This medicine may cause drowsiness. This medicine may cause drowsiness. Apply this ointment to the wound daily. Apply this ointment to the wound daily. I'll give you a prescription for this medication. I'll give you a prescription for this medication. Follow the instructions on the label carefully. Follow the instructions on the label carefully. Call us if you notice any side effects. Call us if you notice any side effects. Never give your pet human medication without our advice. Never give your pet human medication without our advice. You can hide the pill in a treat if needed. You can hide the pill in a treat if needed. Those were important medication-related phrases. Great work so far. You're nearly halfway through. Up next is emergency care. These phrases will help you handle urgent situations. Take a breath and let's continue. We need to stabilize him immediately. We need to stabilize him immediately. She's in critical condition. She's in critical condition. Her breathing is labored. Her breathing is labored. We need to give her oxygen. We need to give her oxygen. Start an IV drip now. Start an IV drip now. Her gums are pale. Her gums are pale. His heart rate is very low. His heart rate is very low. We need to perform CPR. We need to perform CPR. He's going into shock. He's going into shock. We need to operate immediately. We need to operate immediately. Great job! That's 50 phrases down and only 50 to go. If you're finding this lesson helpful, let me know in the comments which phrase you find most useful so far. Now, let's move on to phrases about animal behavior. These phrases will help you describe and handle animal behavior during their visits. It's normal for cats to hide when they're scared. It's normal for cats to hide when they're scared. He might bite, so please be careful. He might bite, so please be careful. She's a bit aggressive today. She's a bit aggressive today. He's very friendly. He's very friendly. She gets anxious at the vet. She gets anxious at the vet. Use a calm voice and slow movements. Use a calm voice and slow movements. He's wagging his tail. That's a good sign. He's wagging his tail. That's a good sign. Her ears are back. She's frightened. Her ears are back. She's frightened. We can try using a muzzle for safety. We can try using a muzzle for safety. Reward her with a treat for good behavior. Reward her with a treat for good behavior. You're doing so well. Keep it up. Now let's talk about record keeping in the clinic. These phrases cover how we document and manage patient records. I'll update her file with today's notes. I'll update her file with today's notes. According to his records, he's due for a rabies shot. According to his records, he's due for a rabies shot. I'll note that in her record. I'll note that in her record. Please fill out this form for our records. Please fill out this form for our records. We'll email you a copy of his lab results for your records. We'll email you a copy of his lab results for your records. Make sure to document his weight change. Make sure to document his weight change. I'll update his vaccination record. I'll update his vaccination record. I'll request his records from your previous vet. I'll request his records from your previous vet. We keep all our records digitally now. We keep all our records digitally now. Her microchip number is in our records. Her microchip number is in our records. Make sure to check out the PDF guide. It includes a glossary covering lots of the terms covered in the phrases today. Our next topic is a very sensitive one: euthanasia discussions. These phrases will help you handle end-of-life conversations with compassion. Let's approach this section gently and with empathy. It might be time to consider putting her to sleep. It might be time to consider putting her to sleep. Would you like to be present during the procedure? Would you like to be present during the procedure? She won't feel any pain. It will be peaceful. She won't feel any pain. It will be peaceful. I know this is hard, and I'm so sorry. I know this is hard, and I'm so sorry. You're making a compassionate choice for her. You're making a compassionate choice for her. Take as much time as you need to say goodbye. Take as much time as you need to say goodbye. He passed away peacefully. He passed away peacefully. Thank you for loving her so much. Thank you for loving her so much. First, we'll give her a sedative so she can relax. First, we'll give her a sedative so she can relax. He was lucky to have such a loving family. He was lucky to have such a loving family. That was a difficult topic, but those phrases can help you offer support. If you've made it this far, you're truly dedicated. Consider becoming a member to get even more learning support. My tier for student members is definitely the one for you. Now, on a brighter note, let's move on to preventative care. How to talk about keeping pets healthy. It's important to keep up with her vaccinations. It's important to keep up with her vaccinations. We recommend a checkup at least once a year. We recommend a checkup at least once a year. Preventative care is the best way to keep your pet healthy. Preventative care is the best way to keep your pet healthy. Keeping her at a healthy weight will help prevent health problems. Keeping her at a healthy weight will help prevent health problems. Brush his teeth regularly to prevent dental disease. Brush his teeth regularly to prevent dental disease. Use a monthly flea and tick preventative. Use a monthly flea and tick preventative. Make sure he gets plenty of exercise. Make sure he gets plenty of exercise. Feed her a balanced diet to keep her healthy. Feed her a balanced diet to keep her healthy. Early detection of problems can save lives. Early detection of problems can save lives. Neutering him will prevent certain health issues. Neutering him will prevent certain health issues. Finally, let's cover phrases for interprofessional teamwork. These are things you might say when working with your colleagues and staff. Could you assist me with this procedure? Could you assist me with this procedure? Let's discuss this case with a specialist. Let's discuss this case with a specialist. Can you double-check this dosage for me? Can you double-check this dosage for me? Thank you for your help with the surgery. Thank you for your help with the surgery. Let's have a team meeting to discuss this case. Let's have a team meeting to discuss this case. Could you prepare the X-ray machine, please? Could you prepare the X-ray machine, please? Our veterinary nurse will monitor her during surgery. Our veterinary nurse will monitor her during surgery. The veterinary technician will take a blood sample. The veterinary technician will take a blood sample. We need to work together to ensure the best care for our patients. We need to work together to ensure the best care for our patients. Please follow up with the lab about the blood results. Please follow up with the lab about the blood results. Congratulations, you made it all the way through 100 phrases. Give yourself a pat on the back. Before we finish, here's a quick recap and some final tips. Practice these phrases regularly and try them in context with your colleagues or even role-playing with a friend. Make sure to come back to the video a couple of times to make sure the phrases really stick in your mind. If you've enjoyed this lesson, please hit the thumbs up and subscribe to Learning English Pro for more professional English lessons. And don't forget, you can download the full PDF guide for this lesson. If you're a student member, it's over on the membership tab waiting for you. If you're not a member yet, the link to join is in the video description. Or you can buy the guide as a one-time download on my YouTube store. Everything's in the description. Hi everyone, welcome back to Learning English Pro, the channel for healthcare professionals like you who want to excel in English and pass the OET exam. In a recent study, it was found that by having a good reading strategy going into the OET, you can improve your final score by up to 20%. That's the difference between passing and having to resit. So if you have any anxieties about the reading segment of the OET, you're in the right place. My name is Ger, I'm a CELTA-trained English teacher and I'm delighted to walk you through my OET Reading Masterclass. Over the next 10 minutes, we'll go through the entire OET reading segment of the exam and I'll give you actionable tips to help you improve your reading skills and strategies to ace this part of your OET journey. Student members of my channel should head over to the membership tab to download a PDF guide for this lesson. It includes 2 full OET reading examinations that you can time yourself and take the test for great practice. If you want to join student membership with Learning English Pro, the link is in the video description. You'll gain access to tons of learning materials and PDF guides for each new lesson. So if you're ready, grab a pen and paper and let's get started on your OET reading journey. First things first, let's understand what the OET reading exam actually involves. It's a 60-minute subtest designed to assess your ability to read and understand different types of texts commonly encountered in the healthcare profession. Part A is all about speed. You have just 15 minutes to answer 20 questions based on 4 short texts on a single medical topic. Your main goal here is to quickly locate specific information. For parts B and C, you'll have a combined 45 minutes. In part B, you'll encounter 6 short texts, around 100 to 150 words each, taken from workplace contexts. For each text, you'll answer one multiple-choice question focusing on the main idea, the purpose, or the writer's opinion. Finally, Part C consists of 2 longer texts, each followed by multiple-choice questions that delve deeper into the writer's opinions, attitudes, and the finer details. Alright, let's dive into Part A, the initial sprint against the clock. Many students find this challenging because of the time constraints. But don't worry, with the right strategies, you'll soon become a scanning pro and be able to find the information that you need quickly. Understand the questions first. Before you even look at the text, read and understand the questions. This will tell you exactly what you're searching for. Identify key words in the questions. Underline or mentally note the key nouns, verbs, and numbers in each question. These are your targets. Scan the text. Don't read every word. Think of it like using a search engine. Your eyes should quickly scan the text, looking for your keywords or synonyms. And that brings us to our next tip. Look for synonyms and related terms. Medical English often uses different words for the same concept. Be prepared for synonyms. The correct answer is unlikely to use the exact same words as the text. It will often be paraphrased. And most importantly, practice time management. Allocate a specific amount of time for each question and move on if you're stuck. Don't let one question eat up all your time. You can always come back to it if you have time at the end. Now, let's shift our focus to parts B and C, where careful reading and deeper understanding are crucial. These sections test your ability to get a grasp on the main ideas, specific details, and sometimes even the writer's opinion. Let's check out some key strategies. First up is to identify the main idea of the text. For each text, ask yourself, what is the writer's primary message? Look for topic sentences and recurring themes. Our next important strategy is to pay attention to linking words throughout the text. Words like however, in contrast, furthermore, signal shifts in meaning or connection between ideas. Familiarize yourself with the different types of questions asked in parts B and C. Knowing what you're being asked to find will guide your reading. Don't just passively read, engage with the text, highlight key information, underline important details, and jot down notes in the margins. This active approach will boost your comprehension, especially in the longer texts of Part C. You won't understand every single word. Focus on understanding the main idea and the information needed to answer the questions. Use context clues to infer the meaning of unfamiliar words. Don't let a few unknown words derail you. Let's quickly see these strategies in action. For Part A, if the question asks about a medication to avoid, or perhaps a piece of equipment, like we have on screen here. Quickly scan the text for the same terms or perhaps synonyms of these terms to find what you're looking for. For Part B, remember to identify the main idea and the writer's purpose. Part B often tests your understanding of whether a text aims to warn, advise, or suggest. Look for language that signals the author's intention. In Part C, you'll need to understand not just the details, but also the writer's stance. Pay close attention to the language used. Are they expressing approval, disapproval, or uncertainty? Words like however, crucially, or strong adjectives can give you clues. So there you have it, a complete guide to mastering the OET reading examination. Remember, understanding the format, practicing effective strategies, and building your medical vocabulary are all key strategies in order to pass and master this test and achieve your professional goals. If you found this lesson helpful, make sure to subscribe to Learning English Pro. And if you want to join the student membership and gain access to the PDF guide for this lesson, the link is in the video description. Student members, head over to the membership tab to start downloading your guide. Think you've mastered OET listening? Here's your challenge. Can you follow 10 real-life doctor-patient conversations that get harder and harder as they go? If you're aiming for top marks, this is the lesson to push your skills to the next level. Hi, I'm Jer, and this is Learning English Pro, the channel for healthcare professionals like you to excel at English communication and prepare for exams like the OET. This lesson is a listening quiz, and it covers medical English conversations on topics such as healthcare, symptoms, and treatments. Actually, it's perfect for anyone interested in improving their English. And here's the challenge. As we move through the lesson, the conversations will get harder and harder. Each conversation will feature two characters, a healthcare worker like a doctor or nurse and a patient. The difficulty will increase in terms of vocabulary, language complexity, accents and context. Each conversation includes two tricky questions focused on symptoms, treatments and severity and patient concerns. Questions will stay on screen, no distractions, and I'll reveal the answers after each conversation. And it's up to you how you want to approach this lesson. If you're interested in active learning, listen to the lesson in full. Find a quiet place to do this. Have a pen and paper ready to take down your answers, and repeat the lesson a few times. Repetition is key. Or maybe you're into passive listening. If that's the case, go about your daily routine and have this video playing in the background. It's a great way to learn medical English with natural listening skills. Student members of my channel can take their learning even further with my exclusive PDF guide for this lesson. It includes full transcripts for each conversation, 6 additional questions per dialogue, and extra exercises like AI homework to replicate the real OET experience. If you'd like to join the student membership and gain access to these amazing perks, click the link in the description below. Alright, let's get started with our first conversation. Grab a pen and paper and pay close attention. Conversation 1.
Good morning, Mr. Jacobs. How are you feeling today?
Not so great, Doctor. I've been feeling really under the weather for a few days now.
I'm sorry to hear that. Can you tell me about your symptoms?
Well, I've had a cough that just won't go away, and I've been feeling very tired. I also have a sore throat and a bit of a fever.
I see. Have you noticed any other symptoms? For example, a runny nose or muscle aches?
Yes, both. My nose has been very stuffy, and my whole body feels achy, especially in the mornings.
That sounds uncomfortable. Have you been drinking plenty of fluids and getting enough rest?
I've tried, but I'm finding it hard to sleep at night because of the cough.
I understand. It sounds like you may have the flu. I'd recommend plenty of fluids, rest, and over-the-counter medication to manage your symptoms. If the fever lasts more than a few days or gets worse, please come back to see me.
Thank you, Doctor. I'll do that.
So that is our first conversation out of the way. How did you get on with the questions? Question 1. What are Mr. Jacobs' main symptoms? The answer is cough, tiredness, sore throat, and fever. Question 2. What does the doctor recommend Mr. Jacobs do? Answer. Drink fluids, rest, take over-the-counter medication, and return if the fever worsens. Great, let's move on to conversation 2.
Good afternoon, Kimberly. What brings you in today?
Hi, doctor. I've been feeling really unwell for the past few days, and it's getting worse.
I'm sorry to hear that. Can you describe your symptoms?
Well, it started with a headache and a bit of a sore throat, but now I've got this horrible pressure in my sinuses, and I feel congested all the time. My nose is completely blocked.
That sounds uncomfortable. How's your energy level?
I'm completely drained. Even simple things like getting out of bed feel like a chore.
I see. Would you say the sinus pressure is your worst symptom?
Absolutely. It's constant, and it's giving me these sharp pains around my eyes and forehead.
I understand. Have you tried taking any medication or remedies so far?
Just some paracetamol for the headache, but it doesn't help much.
Okay, it sounds like you might have a sinus infection. I'll prescribe a nasal spray and some decongestants to relieve the pressure. You should also keep taking paracetamol for the headache.
Thank you. How often should I use the nasal spray?
Twice a day, morning and evening. If you don't see improvement within a week, come back and we'll reassess.
Got it. Thanks, doctor.
Did you manage to find the answers to the questions? Question 1. Which symptom does Kimberly find the most difficult to manage? The answer is the sinus pressure, which causes sharp pains around her eyes and forehead. Question 2. What form of medication does the doctor prescribe to help with Kimberly's symptoms? The answer is a nasal spray and decongestants. It's time for conversation number 3.
Good morning, Mrs. Davies. How are you feeling today?
Oh, good morning, Doctor. I'm afraid I'm feeling rather poorly. I've been under the weather for about a week now.
I'm sorry to hear that. What symptoms are you experiencing?
Well, my chest feels tight, and I have a nasty cough that keeps me up at night. And, to top it all off, I feel as weak as a kitten.
That does sound unpleasant. Have you noticed any shortness of breath?
Yes, especially when I go upstairs. Even a short walk leaves me feeling winded.
I see. Do you live alone, or is someone around to help you if needed?
My son, Richard, checks in on me every evening, and he's been quite a blessing lately.
That's good to hear. I'd like to prescribe an inhaler to help with your breathing and some medication for the cough. Do you have any allergies to medication?
None that I know of, Doctor.
Excellent. Use the inhaler twice a day, and let's see if that eases your symptoms. If the shortness of breath gets worse, please don't hesitate to call us or visit the hospital.
Thank you, Doctor. I'll do just that.
Let's check out the answers to our 2 questions for conversation 3. Question 1 is, how does Mrs. Davies describe her overall strength levels? She says she feels as weak as a kitten. This is a common English idiom used to describe when someone is feeling unwell and not very physically strong. Question 2. Who has been helping Mrs. Davies during her illness? The answer is her son Richard. He checks in on her every evening. Let's increase the difficulty slightly with our next conversation, number 4.
Good afternoon, Mr. Clark. How are you feeling today?
Afternoon. I'm fine, I guess. Just a bit tired lately.
I see. Tiredness can come from a lot of things. Have you been eating well?
I've had a bit here and there. I'm not really hungry much these days.
When you say here and there, what did you have to eat yesterday?
Let me think. I had a slice of bread in the morning, and I think I picked at some soup in the evening. I didn't really finish it, though.
That's not much food for a whole day. Are you finding it hard to eat, or do you just not feel like it?
I just don't feel like eating, to be honest. Everything seems unappealing.
Have you noticed any other changes, like feeling hotter than usual or sweating at night?
Actually, yeah. I've been waking up drenched in sweat the past few nights, and during the day I feel flushed sometimes.
That could indicate an infection. Have you been feeling any pain or discomfort anywhere?
My stomach has been a bit off. It feels heavy, like something's sitting in it, but it's not painful.
I'll take your temperature and check your vitals now. It's important to stay hydrated, even if you're not eating much. Have you been drinking enough water?
I suppose so, but not as much as I probably should.
That's something we'll keep an eye on as well. Once I've checked your vitals, I'll speak with the doctor about your symptoms and get you some fluids if needed.
Thanks. I didn't think it was anything serious.
Let's check out the answers to the questions for conversation 4. Question 1. What does Mr. Clark's recent diet indicate about his health? The answer is, his minimal food intake and lack of appetite suggest potential malnutrition or an underlying illness. Question 2. What symptoms suggest that Mr. Clark might have an infection? The answer is night sweats, feeling flushed, and a heavy feeling in his stomach. We are already on conversation number 5. Well done. Don't forget to take a break if you need one.
Good morning, Ms. Patel. What seems to be the issue today?
Good morning, Doctor. I've been feeling very strange lately. It's hard to explain, but I've been getting these random dizzy spells and this tingling feeling in my hands and feet.
That does sound unusual. How long have you been experiencing these symptoms?
It started about 2 weeks ago, but it's been getting more frequent over the past few days.
I see. Have you noticed any triggers, like certain activities or times of day when it happens?
Not really. It just seems to come out of nowhere. One moment I'm fine, and the next I feel like the room is spinning.
Do the symptoms last long, or do they come and go quickly?
The dizziness only lasts a few minutes, but the tingling can stick around for hours.
Have you had any other symptoms like headaches, nausea, or vision problems?
Well, I've been having a bit of trouble focusing my eyes sometimes, but I thought it was just because I was tired.
That's helpful to know. I'd like to run a few tests to check your balance and reflexes, but we may also need to schedule a CT or MRI scan to get a clearer picture of what's going on.
A scan? Do you think it's something serious?
It's too early to say. The scan will help us rule out anything major, like nerve or brain-related issues, so we can narrow down the cause of your symptoms. It's a precaution.
All right. If it helps figure this out, I'm fine with it.
Our medical conversations are definitely getting a bit more tricky. Let's check out the answers to the questions for conversation 5. Question 1. Why does the doctor decide to schedule a scan for Miss Patel? The answer is to rule out major issues like nerve or brain-related problems and narrow down the cause of her symptoms. Question 2. What unusual symptoms does Miss Patel describe? Answer: random dizzy spells and a tingling feeling in her hands and feet. Let's move on to conversation number 6.
Good morning, Mr. Whitaker. What's brought you in today?
Morning, Doc. I'm feeling proper rough. Me tummy's been giving me jip for weeks now.
I see. When you say your tummy has been giving you jip, can you describe exactly what you mean?
It's like this gnawing pain right in the middle here. Feels like someone's twisting a knife in me gut. Comes and goes, but when it's bad, it's bad.
That doesn't sound pleasant. Have you noticed if certain foods or drinks make it worse?
Well, I love a good brew, but lately, a cuppa's been setting it off something awful. Same with spicy food.
That's good to know. Have you had any other symptoms, like nausea or a burning feeling in your chest?
Nausea, sometimes I feel like I'm going to chuck, but I never do, and now and again I get this sour taste in me mouth. It's proper rank.
It sounds like you might have an ulcer. I'd like to send you for a test to check for that. It could be caused by stomach acid irritating the lining of your stomach.
An ulcer? Sounds nasty. Is it that serious?
It's treatable, but we need to confirm it first. If it's an ulcer, we'll give you medication to reduce the acid and allow it to heal. In the meantime, try to avoid tea, coffee, and spicy foods, as they can aggravate the symptoms.
I can give that a go. Reckon I'll miss me brew, though.
I understand. Let's get this sorted so you can get back to enjoying it soon.
The patient in this conversation definitely had an interesting accent. For our first question, what slang term does Mr. Whitaker use to describe his stomach? The answer is he calls it his tummy. Question 2. What does the doctor recommend Mr. Whitaker avoid to reduce his symptoms? The answer is tea, coffee, and spicy foods. Are you noticing the increase in difficulty in the conversations? Let's check out conversation number 7.
Good morning, Mrs. Turner. What seems to be troubling you today?
Morning, doctor. I've been so worried. My face has been feeling strange for the past few days. It started with this stinging pain, like a tingling across my forehead and around my eyes. Now I've got these awful little sores.
I understand your concern, Mrs. Turner. Let me have a closer look at those sores around your eyes. Have you noticed any changes in your vision?
Not really, but my eye feels a bit irritated, like it's dry or itchy. The pain is the worst part. It feels like little needles under my skin. What's happening to me, doctor?
From what I can see, and based on your symptoms, this looks like shingles, also known as herpes zoster. It's caused by the same virus that causes chickenpox. Have you ever had chickenpox before?
Yes, when I was a child. But shingles? I've heard of it, but I didn't know you could get it on your face. Is it serious?
It can be uncomfortable, but it's treatable. Shingles around the eye, however, need special attention because it could potentially affect your vision if left untreated. I'll prescribe antiviral medication to help your body fight the virus, and we'll keep a close eye on your symptoms.
My vision? Could I go blind?
It's very unlikely, Mrs. Turner, especially since you've come to see me early. The medication will help, and I'll refer you to an eye specialist just to make sure your eye itself isn't affected. You're in good hands.
Thank you, doctor. I've been so anxious. I didn't know what was happening to me.
That's completely understandable. Shingles can be alarming, especially when it's near the eye. Take the medication as prescribed and rest as much as possible. We'll monitor your progress, and I'll be here if you have any concerns.
I'll do that. Thank you so much, doctor.
Let's check out the questions and answers for Conversation 7. Question 1. How does Mrs. Turner describe the pain on her face? The answer is, she describes it as a stinging, tingling pain like little needles under her skin. Question 2. What condition does the doctor suspect and why is it a concern? The answer is, the doctor suspects shingles and it's a concern because it's near the eye and could potentially affect her vision. We are already on Conversation 8. Let's take a listen.
Good morning, Mr. Carter. What brings you in today?
Morning, Doc. Well, I've been feeling off lately. My back's been killing me, and it's like every time I move, I feel this shooting pain, like someone's sticking a hot poker right in there.
That sounds uncomfortable. How long have you been dealing with this pain?
Oh, it's been on and off for months, but lately it's gone full tilt. It's like my back's gone on strike.
I see. Have you noticed anything that makes it worse or better? Maybe certain activities or times of the day?
Sitting in the car or standing for too long makes it way worse. Ice packs help a bit, but honestly, I'm at my wit's end. What's going on here, Doc?
From what you've described, it sounds like you could have a herniated disc or some nerve compression. We'll need to confirm that with imaging, likely an MRI.
A herniated disc? Man, that doesn't sound fun. What's the deal with that? Can it be fixed?
It's manageable. Depending on the severity, treatment can range from physical therapy and anti-inflammatory medication to more invasive options like steroid injections. Surgery is a last resort if nothing else works.
Surgery? That's a bit heavy. What would you do if you were in my shoes?
If I were in your situation, I'd start with the least invasive options. Physical therapy is often very effective, and anti-inflammatory medication can help reduce swelling and pain. If the pain doesn't improve after a few weeks, we can explore further options like the injections.
That makes sense. I'm not too keen on surgery unless I absolutely have to. What about over-the-counter meds?
Over-the-counter options like ibuprofen or naproxen can help in the short term, but we may need to prescribe something stronger if the pain is severe. I'll also recommend some exercises to strengthen your core, which can support your back and relieve pressure.
Core exercises, huh? Guess I can't keep putting that off. You're saying there's hope though, right?
Absolutely. With the right approach, most people see significant improvement. The key is sticking to the plan and keeping me updated if anything changes.
Got it, Doc. Let's start with the basics and go from there. Thanks for walking me through it.
Let's check out the answers to our questions for Conversation 8. Question 1. What condition does the doctor suspect Mr. Carter might have? The answer is a herniated disc or nerve compression. Question 2. What treatments does the doctor recommend starting with? The answer is physical therapy, anti-inflammatory medication, and possibly over-the-counter pain relief. It's time for Conversation 9.
Good afternoon, Ms. Rivera. How are you feeling today?
Honestly, doctor, I'm not sure how to even describe it. It's like my body is betraying me. I've been exhausted, but no matter how much I rest, I still feel wiped out. And then there's this buzzing sensation in my legs. It's driving me insane.
I see. Let's take it one step at a time. How long have you been feeling this way?
A few weeks, maybe more. At first, I thought it was just stress from work, but now it's different. It's almost like I don't trust my own body anymore.
That must be very unsettling. Can you tell me more about the buzzing sensation? Is it constant or does it come and go?
It's not constant. It's worse in the evenings. It feels like my legs are alive. Like there's electricity running through them. I can't sit still, but moving doesn't really help.
That sounds frustrating. Have you noticed any other symptoms like muscle weakness or changes in your sleep?
Well, my sleep's been awful. I keep waking up, sometimes feeling like my legs jerk on their own. And as for weakness, it's hard to say. I don't feel weak exactly, but I don't feel steady either.
That helps paint a clearer picture. From what you've described, we could be looking at something like restless leg syndrome or even an issue with nerve function. I'd like to run some blood tests to check your iron levels and other markers. We might also consider a nerve conduction study if needed.
Restless legs? I've heard of that, but it sounds so minor. This doesn't feel minor, doctor. It's taking over my life.
I completely understand. While restless leg syndrome might sound simple, it can have a significant impact on your quality of life, especially if it's disrupting your sleep. That's why we take it seriously.
But what if it's something worse? What if it's neurological? Could this be a sign of something like multiple sclerosis?
I hear your concern, and it's completely valid to feel anxious about the unknown. Right now, there's no indication of a condition like multiple sclerosis, but if we see anything in the tests that suggests otherwise, we'll address it immediately. For now, let's focus on the likely causes and start with the appropriate tests.
I suppose that makes sense. It's just hard not to spiral when you don't know what's happening to you.
That's completely understandable, Ms. Rivera. Remember, you're not alone in this. We'll take this step by step, and I'll be here to guide you through whatever we find.
Let's review the questions and answers for our 9th conversation. Question 1. How does Miss Riviera describe the sensation in her legs? The answer is, she describes it as a buzzing or electrical sensation that gets worse in the evenings. Question 2. What test does the doctor suggest to investigate her symptoms? The answer is blood tests to check iron levels and other markers, and potentially a nerve conduction study. Well, you've made it to the final 10th conversation, and this one is a lot more difficult than the others. And to make it even more interesting, I've added a 3rd question for you to consider.
Good morning, Mr. Grant. What brings you in today?
Morning, Doctor. Honestly, I'm at a loss. I've been feeling progressively worse over the last couple of months, and I can't seem to pinpoint what's wrong. I've got this fatigue that just won't quit, even when I sleep well. My hands and feet feel numb sometimes, and lately I've noticed I've been losing weight without trying.
That sounds concerning. Let's break it down. When did the fatigue and numbness first start?
I'd say the fatigue started about 4 months ago, but it wasn't as bad back then. the numbness, maybe 2 months ago. At first, it was just a tingling sensation, but now it's more like complete numbness in my fingers and toes. It comes and goes, but when it's there, it's really unsettling.
I understand. And the weight loss, how significant has it been?
About 15 pounds in the last 2 months. I haven't changed my diet, and honestly, I've been eating less because I don't have much of an appetite.
Have you experienced any other symptoms, like dizziness, difficulty breathing, or changes in your vision?
I do feel lightheaded sometimes, especially if I stand up too quickly. No problems with breathing or vision, though.
And how's your energy level throughout the day?
It's terrible. By mid-morning, I feel like I've hit a wall. I used to exercise regularly, but now even walking around the block feels like too much.
Have you noticed any changes in your skin or unusual bruising?
Actually, yes. My skin's been really dry, and I've noticed a few bruises on my arms and legs that I can't explain.
Based on what you've told me so far, there are a few possibilities we'll need to explore. The combination of fatigue, numbness, weight loss, and unexplained bruising could point to a range of conditions, from a nutritional deficiency to something more systemic, like a blood disorder or autoimmune disease.
A blood disorder? Like cancer?
It's too early to jump to conclusions, Mr. Grant. But we need to rule out serious conditions, including blood cancers like leukemia, as well as autoimmune issues like lupus or even diabetes-related complications.
I see. What's the first step?
We'll start with a comprehensive blood panel to check for anemia, vitamin deficiencies, blood sugar levels, and markers for inflammation or infection. Depending on those results, we may need imaging tests or a referral to a specialist.
How long will it take to get answers?
Blood test results usually take a couple of days. If we need additional tests, like imaging or a biopsy, that could take a bit longer. I'll make sure we move as quickly as possible to figure this out.
I've been trying not to overthink it, but it's hard not to worry. I've felt like I've been slowly falling apart.
I completely understand. This can feel overwhelming, but you've done the right thing by coming in. Let's focus on getting the answers we need. In the meantime, try to eat small, nutrient-rich meals and keep hydrated, even if your appetite isn't great.
Thanks, Doctor. I appreciate it. I just hope we figure this out soon.
We will, Mr. Grant. You're not alone in this, and I'll be here to guide you through every step.
Well done, that was quite a tricky final conversation. Now it's time to check out our questions and answers. Question 1. What symptoms does Mr. Grant describe that concern the doctor? The answer is fatigue, numbness in his hands and feet, unexplained weight loss, lack of appetite, lightheadedness, dry skin, and unexplained bruising. Question 2. What test does the doctor recommend and why? The answer is a comprehensive blood panel to check for anemia, vitamin deficiencies, blood sugar levels, and markers for inflammation or infection. Our final question, question 3. Why does the doctor emphasize ruling out both blood disorders and autoimmune conditions? The answer is because the combination of symptoms, fatigue, numbness, weight loss, bruising, and dry skin, could indicate systemic issues affecting either the blood or immune system, requiring further investigation to identify the cause. And that brings us to the end of our extensive OET listening examination. Well done for completing the entire course. Let me know in the comments which conversation was your favourite and how you got on with the questions. Some of them were really tricky. Student members, don't forget to head over to the membership tab to download your exclusive guide for this lesson, which includes 6 extra questions for each conversation. And you'll also get additional exercises like my new AI homework. If you've Hello, I'm Jer and welcome to Learning English Pro. I'm your CELTA qualified English teacher and today I'm giving you 100 powerful phrases you can use every day when working with young children in English. So whether you're in a Montessori, a creche, a preschool, a kindergarten or working as a nanny, these phrases will help you communicate with clarity, care and confidence. As educators, we know how essential it is to use language that's gentle, clear and consistent, especially with children who are developing their understanding of the world around them. Each of the phrases in this video is designed to help you manage behavior, guide routines, and build strong, trusting relationships with the children in your care. There's also a brilliant downloadable guide with this lesson. It includes all 100 phrases, extra language tips, and a glossary of useful terms, along with 2 exercises to check your comprehension around this English topic. You can access it as part of my student membership, which is $4.99 a month, or you can grab it as a one-time download in my YouTube store. Everything is linked in the video description. If this is your first time with the channel, make sure to drop a like and subscribe for lots more English content. So let's dive right in and start with the most important part of the day, welcoming children and helping them settle in. Good morning, it's lovely to see you. A warm greeting like this builds emotional safety and lets children know they're valued the moment they arrive. Can you hang up your coat, please? This gentle prompt encourages independence while still using polite, respectful language. Let's say goodbye to Mum and Dad together. When separation is hard, this shared moment helps ease the transition and shows empathy. Would you like a cuddle or a wave? We're offering choice and comfort here. Both are supportive ways to create emotional security. Here's your name card. Can you find your cubby? This phrase mixes routine with early literacy and helps build a sense of personal space and responsibility. Let's start with a smile today. This small phrase invites positivity and helps shift focus onto the present moment. You can choose a book while we wait. Offering choice promotes calm autonomy while children wait for the next step in the routine. Come sit with your friends on the carpet. Here we have a soft invitation that models inclusive language and supports group belonging. Take your time. We're in no rush. When spoken sincerely, this relieves pressure and encourages children to move at a pace that feels safe. Are you ready to start your day? We're using this question to empower the child and help them transition with awareness. Settling in is emotional work. Giving children simple, predictable language during this part of the day builds trust. Next, let's look at phrases that support daily routines and smooth transitions. Time to line up at the door. This phrase is both directional and rhythmic, helping the group move in a coordinated, safe way. Please wash your hands now. A hygiene reminder like this is a key part of routine building. It's short, clear, and polite. Tidy up time. Put away your toys. Time phrasing like this becomes a cue for action, and it helps children associate language with routine. Let's get ready to go outside. Here we are preparing children mentally for a change in activity, which helps with transitions. Put on your coat if you're going outside. This prompt builds independence in weather-appropriate dressing while reinforcing logical thinking. Shoes on, please. These 3 words are highly effective. This is direct, respectful, and action-focused. One at a time, please. With this, we're modeling social patience and managing safety during high movement times. Let's wait quietly. This encourages both patience and self-regulation, 2 key skills in early development. Are you all ready? Let's move on. We're inviting a collective check-in and giving the group permission to proceed. Raise your hand if you need help. This is a great way to teach self-advocacy and establish structure in group interactions. Routines help children feel safe and confident. If you're finding these phrases useful so far, don't forget to like, subscribe, and consider joining the student membership with Learning English Pro for more exclusive content and downloadable lesson guides. Walking feet, please. Instead of saying don't run, we focus on the expected behavior in a calm, positive, and proactive approach. Use your kind hands. This phrase encourages gentle touch and introduces emotional vocabulary like kind. Inside voices, please. Here we're guiding the volume level based on context. This helps children modulate their energy. Let's remember our quiet hands. This is a child-friendly way to remind children not to touch things or others unnecessarily. That's not safe. Let's try another way. Instead of scolding, we're teaching problem solving and keeping things calm and constructive. It's okay to feel upset. Let's take a breath together. This phrase validates emotion and offers a co-regulation strategy, a key part of emotional literacy. We take turns with our toys. Here we are communicating a social norm while reinforcing fairness in shared spaces. Let's use our words to solve this. This phrase redirects behavior toward verbal problem solving and models emotional intelligence. We show respect by listening. This is a values-based phrase that links action, like listening, to character development, like respect. Great job making a kind choice. We're offering behavior-specific praise here that reinforces decision-making and empathy. Behavior support is about clarity, consistency, and kindness. Next, let's turn to encouragement, because children thrive when we notice and name their efforts. You're doing a great job. And this is a classic and powerful phrase to reinforce general effort and create a sense of progress. That was really helpful, thank you. Gratitude-based praise encourages cooperation and makes children feel valued in their role. I saw how you waited so patiently. Here, we're highlighting a specific positive behavior, which makes praise much more meaningful. You tried something new today. Well done. Trying new things takes courage. This phrase recognizes emotional risk and rewards bravery. I'm proud of how you handle that. This form of praise focuses on emotional regulation, especially after moments of challenge. Look how much you've improved. We're focusing on growth over perfection, critical for building confidence. What a great idea you had. This celebrates creative thinking and reinforces the value of each child's contributions. You were very gentle with your friend. Here, we're reinforcing kind actions in real time, which strengthens empathy and peer relationships. Thank you for helping clean up. With this sentence, we are acknowledging helpfulness, which boosts motivation and responsibility. You're a great listener today. Listening is a learned skill. This phrase rewards effort and builds group harmony. When we name and praise specific behaviors, we shape how children see themselves. If you're enjoying this so far, drop a comment below and let me know which topic you'd like to see next. Primary school, babysitting, high school? I'd love to hear from you. Play is where language and creativity grow together. Next up, our phrases will help guide play without interrupting it and support children as they learn through doing. Let's build something together. Here we're inviting collaboration. This phrase encourages teamwork and shared focus during constructive play. Can you show me what you made? This question is all about fostering pride and communication. Asking a child to explain their creation builds narrative thinking and confidence. Would you like to play with this? This models polite offering and reinforces the idea that play can be shared and negotiated, not just claimed. Let's pretend this is a spaceship. By introducing pretend play, we support cognitive flexibility and creative thinking. You can be the chef today. Assigning playful roles strengthens imaginations and introduces early social scripts like responsibility and turn-taking. Can you find the red block? This phrase supports colour recognition and problem solving, and it's great for embedding vocabulary into play. It's fun to work as a team. We use this to highlight positive group behaviour. Phrases like this help children understand the joy of collaboration. I love how you're sharing. Here, we reinforce good behaviour in the moment, using observation-based praise that's personal and immediate. If you are finished, please put the toy back in the box. This phrase promotes self-responsibility when it comes to cleaning up after oneself. Let's tidy up together. By including ourselves in the action, we make cleanup feel shared, not a punishment, but a part of the play cycle. Play is the foundation of early learning, language, relationships, even maths and problem solving. They all start here. If you want even more support, the downloadable guide for this lesson is available now with all 100 phrases and extra tips. Grab it in my YouTube store or you can unlock it with student membership. Let's move on to our next topic, Topic 6, Group Time and Circle Activities. Circle time brings children together for stories, songs, and shared learning. These phrases keep things inclusive, calm, and engaging. Let's sit in a circle, please. This phrase promotes both instruction and structure, creating a visual and social sense of unity. Who wants to start our song today? We're encouraging leadership and participation while making the group feel like a team. What do you think will happen next? Here we have the perfect question during storytelling. It builds anticipation and develops inference skills. Can everyone see the book? With this, we're making sure no one is excluded. Physical access supports emotional engagement. Let's take turns speaking. This is an early introduction to respectful conversation and gives children a framework for sharing. That's a great idea. Thank you for sharing. We're validating verbal contributions here, which builds confidence and reinforces listening culture. Let's clap for our friend. Group praise like this teaches positive peer reinforcement, and it helps children feel proud in front of others. This story is about being brave. We're previewing the emotional or moral message of a book, which supports comprehension and connection. Hands on laps, eyes on the book. This phrase guides physical stillness while gently pulling focus to the activity at hand. Who remembers what happened yesterday in our story? This phrase supports memory and sequencing, essential skills in both reading and social conversation. Circle time teaches far more than stories or songs. It teaches focus, empathy, and community. Coming up next, let's explore phrases for hygiene, meal times, and rest, those calm, practical parts of the day that help everything else run smoothly. Let's wash our hands before we eat. A predictable hygiene routine is one that also supports transitions and responsibility. Take small bites, please. With this phrase, we're guiding safe eating behaviours while encouraging calm and patience. Use your spoon, not your fingers. This is a gentle reminder that reinforces table manners and fine motor development. Please sit on your bottom. This phrasing is commonly used in childcare to promote safe and stable seating during meals. Would you like more, or are you all done? Here we're offering choice and modelling polite food-related language. Time to brush our teeth. This statement is a direct, upbeat hygiene prompt that works well as part of routine building. Let's lie down and close our eyes. This phrase introduces rest time gently, with an invitation rather than a command. You don't have to sleep, just rest your body. Here, we reduce pressure and acknowledgement that children have different needs. Use your quiet voice. It's nap time. This reinforces environment-appropriate behaviour while maintaining a calm tone. Okay, everyone, time to wake up. Here we have a nice prompt which encourages children to wake up and get active. These routines teach responsibility, self-care, and emotional regulation. If this resource is helping, share it with a colleague or drop a like to support the channel. Now, let's turn to a crucial skill, how we talk to the parents. Clear professional communication builds trust and shows families that their child is known, safe, and supported. She had a lovely day today. This phrase is a warm, non-specific update that reassures parents at pickup. He was a bit tired this afternoon. This statement shares a behavioural observation neutrally, helping parents stay informed. We did painting this morning. He really enjoyed it. This describes both the activity and the emotional engagement, which parents value. Can we have a quick chat about lunchtime? This opens a gentle doorway for addressing a possible issue respectfully. She's been doing really well with sharing. This is a strength-focused update that reflects social development. I've noticed he's been quieter than usual. Has anything changed at home? This shows care and opens space for shared insight between school and home. Thank you for bringing in the extra clothes. This small gratitude keeps the relationship between teacher and parent positive and professional. He had a small accident today, but he's okay. Here we are delivering necessary information with calm reassurance. No drama, just facts. Feel free to message if you have any questions. This statement invites ongoing communication and shows you're open and responsive. We're really enjoying having her in the group. This phrase affirms the child's belonging and offers a lovely emotional closing to the day. Parents want to know their child is seen and understood. Simple professional phrases like these build lasting trust. Next, we'll look at how to communicate with your team and support each other in the workplace. These phrases will help you collaborate clearly, respectfully, and efficiently with others in your setting. Can you help me set up the snack table? And here we have a simple, polite request that shows respect and clarity in shared tasks. Let's do a quick check-in before the children arrive. This promotes daily planning and consistent communication, keeping routines running smoothly. I'll take the outdoor group today. And here we have a clear declaration of responsibility. It's useful for dividing duties without confusion. Could you watch my group for a minute? This question asks for temporary support, without assumption, but it's polite and practical. Thanks for your help this morning. This kind of gratitude strengthens team morale and fosters a culture of mutual respect. Have you noticed anything different about Leo today? This question opens a professional dialogue about child well-being and shared observations. Let's keep each other updated about snack allergies. Health-related communication like this must be clear, proactive, and inclusive. I've added notes to the daily report. Can you check them later? Here we are promoting shared documentation and accountability in record keeping. Let's debrief after nap time if you're free. Here, we're creating space for reflection and problem solving in a calm, proactive way. We make a great team. This phrase is simple, affirming, and morale boosting, and it recognizes shared effort. Strong teams support strong classrooms. When we model respectful, clear communication with colleagues, it filters into everything we do with the children. But sometimes children just need a little help understanding or managing their feelings. Our final topic brings us phrases that support emotional regulation with kindness. It's okay to cry. I'm right here. This phrase validates emotion while offering comfort and presence. Let's take a breath together. This co-regulation strategy helps calm the nervous system and builds self-soothing skills. Would you like a hug, or do you want some space? Here, by offering choice and comfort, it helps the child build autonomy and emotional literacy. You're safe now. This phrase is short but powerful. It helps ground a distressed child with reassurance. Let's use calm voices. This models emotional containment without shame, even in high-energy situations. Tell me what happened. Here we invite expression before judgment. This builds trust and supports restorative practice. Let's try again together. With this statement, we are encouraging resilience and showing that mistakes are part of learning. That feeling has a name. It's called frustration. And here we have a great way to help children label emotions, a critical step in emotional development. Would it help to sit quietly for a minute? Offering space without punishment gives children tools for self-awareness. You did your best. I'm proud of you. Here we have a moment of affirmation, regardless of whatever an outcome can be. This helps children feel valued and supported. And that's all 100 phrases for childcare. Whether you're teaching routines, guiding play, supporting behavior, or managing tough emotions, language is your most powerful tool. I hope these phrases help you feel more confident and connected in your work with children. Don't forget, the full guide is available in the YouTube store or with your student membership. It includes all 100 phrases, bonus language tips, a useful glossary, and additional exercises to ensure that you comprehend this topic. And let me know in the comments what topic you'd like me to cover next. Primary school, babysitting, high school students? Drop a comment and let me know. Thank you so much for joining me today. I've loved having you here. I'm Jer, this is Learning English Pro, and I'll see you in the next lesson.